Namaskar. I extend a warm welcome to all the participants who have joined us today on World Autistic Awareness Day. When I was being trained as a teacher, and probably when you were being trained as a teacher, one thing that was told to all of us is that no two children are alike. ये जो बात है कि हर बच्चा भिन्न है, this applies to all children, and it applies most to children with autism. Children with autism are all different. Autism spectrum disorders are a diverse group of conditions, and characteristics of children with autism may be detected in early childhood, but autism is often not diagnosed until much later. It is not a disease that can be cured. If I'm autistic today, I'll be autistic tomorrow, day after, and for my life. So, what needs to be done is we need to create an awareness about who are these children and how can they learn according to their potential along with other children in our society. The abilities and needs of people with autism vary and can evolve over time. While some people with autism live independently, others require lifelong care and support. People with autism are often, as we see, subject to stigma, discrimination, and human rights violation. If I look at a mother who may be playing with her children in a garden in the evening and just watching them play and be happy, a mother or a father or a caretaker of a child with autism will not be feeling the same emotions in the garden. She or he would be standing on toes, wondering what next may be facing the child. So these children are, as I said, subject to stigma, discrimination, and human rights violation. Care for people with autism needs to be accompanied by action, by you, me, community, at the societal level for greater accessibility, inclusivity, and support. The goal of today's event is to raise awareness for autism. The event will begin with an introductory remarks that will be delivered by Shri Santosh Yadav, Additional Secretary, Department of School Education and Literacy, and Professor Amrendra Behra, Joint Director, CIT. The event today will conclude by Director NCERT's remarks and remarks of former Chairperson, National Trust for Persons with Autism. The day today will include a series of sessions, and we have picked our speakers with great care. We will have speakers who represent the medical domain, educational experts. They will help us know the child with autism better and how we can teach the child. We will also have parents sharing their views about how they raised their children and what they went through. And we will have a session on the role of technology before we close the session with a roadmap ahead. Friends and participants who have joined, you all know that the People's Policy, the National Policy on Education 2020's vision broadly emphasizes that classes are no longer having children who are similar or have heterogeneous makeup. These sort of classrooms do not exist anymore. It tells us that our aim should be to create a system of education that's aligned to the aspiration goals reflected in SDG 4 and RPWD Act 2016. In tune with this dedicated endeavors, we must continue to address all challenges together and encourage inclusivity in all learning environments. Children with autism have a right to appropriate education, and therefore there's a need to prepare all stakeholders to address the unique and diverse educational needs of these children in both inclusive and special settings if needed. In addition to supporting special educators, inclusive education requires that regular educators be prepared for meeting the diverse needs of learners. What does research tell us? Research shows very clearly that inclusion is the most cost-effective and most effective academically, socially way forward. And segregated schooling is something that we need to revisit and relook at, since all children benefit from learning together. Inclusion and inclusive practices, when they begin early in school, lead to inclusive societies and ultimately to an inclusive nation which we all aspire to build. I once again formally welcome all of you and wish you an enriching experience in today's session. It's my pleasure now to request Shri Santosh Yadavji, Additional Secretary, Department of School Education and Literacy, to give his introductory remarks today. Over to you, sir.
Good morning, Professor Ahuja. Very well said, very well laid out today's context. I am privileged to have with us faculty from AIMS, practitioners, teachers, parents, and wide audience of listeners. Today's day, World Autism Awareness Day, envisaged by United Nations General Assembly. You know, I was just looking at our system, the school education system. We got 25 crore students. In 25 crore students, children with special needs, as you call them, we could identify only 23 lakhs, so barely 1%. And again, I was just going through what is the numbers for children with this autism spectrum disorder. This number is, out of this 23 lakhs, only 24,000, which means out of 24 crores, 25 crores, 1% we could identify children with disability. And out of children with disability, children with special needs, of the 21 disability identified by Iep Act 2016, this particular disability of which we are today gathered, it's further 1%. So what today's event, why it is important? Important is because let us raise the awareness. Let us raise the awareness not only in the society but in the teachers also. How to identify these kids? You know, there are in our school system there are 1 crore teachers, to be very precise, 96 lakhs, and we have to the tune of 30,000 special educators. So this number is very, very less. So unless until the general teacher, 96 lakh minus this 30,000, unless until they are made aware of it, we cannot surpass this challenge. So generally what happens? And this, because awareness, training is not there. So the children with autism are generally clubbed with children. They are identified as children who have mental challenges, other SLDs, which is not the case. So, you know, let's understand from the country's point of view. You know, children with disability, he is consuming as much resource of the country as me and you. And we are not able to take best out of him. So he is not, as we are not able to take best out of him. So in the whole milieu of the GDP of the country, we are not able to take his contribution. So in a way, nation is also suffering. So it is in the best interest of everybody. Not only that kid, in the interest of society, of which we are also a member, in the interest of nation, we have to take them together. That's why this policy of NEP 2020, it talks about inclusion. It says include. So the children with disability has to be included with other children. The way today's event is organized, I'm pretty sure it will have wonderful results. It will create awareness, it will create sensitivity, it will provoke teachers, faculty, and everybody in society to walk extra mile. Walk extra mile, be extra sensitive for these kids. I'm pretty sure with by today's event, we will be more aware, society will be more get more sympathetic to it, and teachers in particular will get more information and more awareness. Thank you. Thanks a lot. All the best for today's event.
Thank you very much, sir. Indeed, we will all work together and walk the extra mile, as you are saying. And I'm sure that as our speakers share their thoughts, as you rightly said, we will be able to create that awareness that is required in the system and increase our understanding about these children. Thank you once again for motivating us and being with us. I now request Professor Amrendra Behra, Joint Director CIT, to share his views. Over to you, Amrendra.
Thank you very much, Madam. Esteemed Sri Santosh Yadav ji, Additional Secretary, Department of School Education and Literacy, Ministry of Education, Government of India. Esteemed Professor Anupam Ahuja ji, Head Department of International Relations in NCERT, and distinguished academia from various institutions, including AIMS, and also my colleague Dr. Bharti, and esteemed Director NCERT, and the viewers, teachers, students, would-be teachers, people teachers, and parents, those who are watching this show. First of all, on my personal behalf and on behalf of NCERT, I welcome all of you to this half-a-day session on sensitization, particularly awareness on autism, and my greetings and best wishes on World Autism Day. So with this initial welcome, I must welcome one and all who are watching this program, and I must put the context before you in continuation to what Professor Anupam Ahuja ji and what Sri Santosh Yadav ji, Additional Secretary, Ministry of Education, said, that the NEP 2020, National Education Policy 2020, has given a lot of stress on holistic development of every child. And when we talk about every child, so the children who are covered under the revised PWD Act 2016, the 21 variety of children come under that, and autism is one. And there are a large number of population in India, in other countries also, where we find children of this nature or this characteristics, and they have every right to be nurtured in the system and be a responsible citizen in the society, and useful and productive citizen also. And as part of human right, we have to safeguard their interest also, to bring them to the education fold and provide equitable quality education and lifelong learning for them, which is the policy goal. And we definitely bring the stakeholders need to analyze why this happens, and if this happens at prenatal stage, postnatal stage, even during their upbringing also, what kind of content, pedagogy, technological integration we teachers need to happen, do in the classroom, outside the classroom, and in the school environment and outside the school environment, so that these children are identified in a time-bound manner, and they are nurtured in the system in a way they feel that they are cared in the system, and their whole potential holistic development, what is visualized by the policy needs to be achieved. While talking about these children also, they tend to become very creative at many stages. We might have seen many children, those who have been established themselves, even if all odds. Even we can take the example of Michael Phelps, so a great swimmer. So even also many other children across the country and the world, those irrespective of all these odds, they have proved themselves in the society, and they have proved that they are very creative and intelligent, which we have naturally we acquire from the parents some basic tenets, some basic characteristics. So let us join together in the system. So whether it is corporate, whether it is government, non-governmental organization, entrepreneurs, even startups and volunteers, parents, general public and students, because many a times the peer group, they are considered very constructive peers. So if we have a child who is identified as autistic, and we provide appropriate support to that child as a peer, as a teacher educator, as a parent, as a system as a whole. So then no doubt the child will prove himself and herself. And another thing is the Sustainable Development Goal 4, that equitable quality education and lifelong learning to every child needs to be achieved also. And 21st century skill like communication, cooperation, collaboration, critical thinking, creative thinking and problem solving. These children have every right to also be nurtured to develop these skills. So let us join together and converge all our efforts and nurture these children and take them to new heights, and they contribute in the society and the economy, as Santosh Yadavji was also mentioned, in a meaningful manner. So with these words, once again, I welcome all the academia and the parents, those who are watching this show live, and welcome once again. And I hope this half-day program will help us to get ourselves sensitized, to prepare ourselves to help the children to nurture their hidden talent. Thank you very much. Over to Professor Anupam Ahuja.
Thank you, Professor Amarendra Behraji. Indeed, their latent challenges need to unfold, and we are all aware that each one, as I said at the outset, is different, can achieve great heights. JRI, for example, who swam through Sri Lanka, has achieved some laurels which make us stand proud. Everybody cannot be JRI, but every child needs to be nurtured. And that message which you have given is really indeed something we need to hold on to always with us. Thank you. And with this, I now go to our session 1 of today's program, and let us look closely at these children, as the emphasis of the inaugural talk has guided us. Let us try to know these children with autism better. And for this, we have two speakers with us who have a lot to share and have a background which is a lifetime contribution in this area. I have with me the first speaker, Dr. Rajesh Sagar. He is a professor of psychiatry and in charge of the Autism Clinic at AIMS, Delhi. Let me tell you just a little bit about him, and he will be followed by an educationist of great name and repute, Miss Mary Barua, who is the founder of AFA. Let me tell you, to begin the session, a little bit about Dr. Rajesh Sagar. He is currently, as I just said, working as a professor in the Department of Psychiatry at AIMS, New Delhi. He is a MD from NIMHANS, Bangalore, and certificate of completion of specialist training he obtained from UK, and he's been awarded many fellowships He has a fellowship of the National Academy of Medical Sciences, International Medical Science Academy. He was also awarded by the Royal College of Physicians, Edinburgh, UK, and is an honorary professor in the Department of Psychiatry in Australia and in universities in Australia and UK. Currently, he is a member of the Central Mental Health Authority, Government of India, and he has been National Mental Health Policy Groups. He has been nominated member, and he has been and continues to be an expert for several organizations, including expert member of various national task forces on COVID by ICMR and the Ministry of Health and Family Welfare. Dr. Sagar writes with great determination to reach out to many, and he has many published articles and over 500 research papers to his credit. Books are full of his chapters, and he has received several awards and honors, including the ICMR Award, Outstanding Researchers Award, as a country's topmost researcher in psychology and mental health. With this brief introduction, I now ask him to share his thoughts on and helping us understand the needs of these children more closely. So over to you, Dr. Rajesh Sagar.
Good morning to you. I hope everyone can hear me.
Yes, we can.
My voice is fine. Just say yes if you can hear me.
Yes, we can.
Okay, great. Wonderful. First of all, my greetings to everyone on this wonderful occasion of World Autism Awareness Day. And I am very thankful to Professor Anupam Ahuja to invite me and to have this discussion on this important day. And I'm thankful to NCERT and all those who have been associated with this program, and all the parents and everyone who have joined. My greetings to them. And I just heard the kind of activity what you have been doing. It's wonderful. So it's great to be here. And I am a professor of psychiatry, and I do run a child adolescent psychiatry clinic for last several years. And of course, autism, ADHD, and all the neurodevelopmental conditions which are there, they do visit us in our OPD, and we do take care of these children. We also have inpatient facility also. So it is wonderful to talk, and briefly for 20 minutes, I will be going through some of the important aspects which we can talk today. Can I share my slides? Is it okay? Or?
Yes, please go ahead.
Okay, fine, wonderful. Okay, and I hope you can see my slides also.
Yes, we can.
Okay, fine. So this is the topic, knowing the child with autism. I think I will briefly take you through this. And these are some of the outline that I will be talking in these 20 minutes. That is World Autism Awareness, what's the importance of it, identifying autism, sign and symptom, what's the diagnosis and management, briefly. And what the parents can do, I think, and happy to hear that many parents have joined. And since this program is by NCERT, so will be focusing also on the inclusive education for children with autism and the role of teacher, which we believe is so important. And I was just focusing on briefly touching on these topics. Now, we all know that UN declared April 2nd as a World Autism Awareness Day, and supported by all members. And this year it's the 15th annual. And the theme, I think it's important for us to know, it's the inclusive education. I'm happy that this today's event is being organized by NCERT, and inclusive education in the context of SDGs, Sustainable Development Goal 4. So goal 4 is basically what? It is, there are 17 goals, and 4 is basically inclusive education and the opportunities to everyone for learning all throughout the life. So that is what this SDG 4 is. And the topic, the theme is inclusive education in the context of SDG 4, the promise and reality. Just to tell you, the last year the theme was inclusion in the workplace, challenges and opportunity in the post-pandemic world. So you can see there is it's a linking with the last year theme and this current year theme also. So because they're talking about the inclusive education part. Now, why we need to have this discussion today, and what's the purpose of this, and what's the put the context right. So basically, the idea is that, you know, to highlight the need to improve the quality of life of those with autism. I think that's what we all are thriving for, and we all are working for, and to have to full and meaningful lives as an integral part of the society, and to educate public about early signs and symptoms of autism spectrum disorder. And again, I wish to tell you that definitely recent time the awareness has increased. There is no doubt about that. In fact, what I see about 30 years ago and today's context, a lot of changes have made positively with regard to autism and child with special needs overall. But yes, much more needs to be done. And all the we need to discuss about the issues of concern, that is creating awareness about importance and initiating early and effective management strategies, and reducing the myths and stigma which is there of autism, and supporting parents or caregiver or people with autism. And the other important thing is that to mobilize the political will and resources to address the challenges and barrier. I think that becomes a very important aspect and put the context right, and to achieve the stated goals, and to celebrate overall. You know, I understand that we need to celebrate the achievements overall with humanity and achieving the above stated goals. So this is what the today's event is all about, and basically that's what we need to be the advocates for child with autism, and much more needs to be done in this regard. And what are the ways how we can do? One, of course, is that how we can appreciate the today's date, that is to create the awareness of signs and symptoms, and to also talk about the risk factors, management strategies, and helping them to realize their full potential. And this is a very important concept, neurodiversity or the neurodivergence. I will just tell you, by Rudy Singer in 1998, a sociologist gave this term. And what it means is it's the differences which are there with regard to attention, mood, on overall mental function what an individual have. So what it means, it's not a disorder. It's a kind of a divergence. It's a kind of diversity which is there. So that is what the whole aspect of neurodiversity we need to understand. And of course, autism is also one of them. And we need to see that how we can accommodate these differences, basically. That's what the whole idea is. Prioritizing the acceptance, it is not only the awareness, but also acceptance, you know. And as advocates, we need to stress on autism awareness. It should not be the end goal. Awareness should not be the end goal. What is important is that how most people are aware of autism. We know that to large extent, but the acceptance is much more. We need to see that how people need to accept. We'll talk about that in more detail. Autism acceptance means listening to individual autism and also learning from their stories. And of course, in some countries, it starts a week before or month before and so on for the overall appreciation and the broader acceptance. So this is what I was talking about. That it is not just, we should not end at the awareness part. And of course, though the theme is awareness, but the point is that we need to go beyond awareness and go to the acceptance part. So awareness means that we know that it exists, but at the same time, acceptance, what it means is to connect personally and learn more. Awareness, of course, is identifying, but we need to see that, which again, we need to talk to people and gain the understanding, compassion, and sensitivity. I think that becomes a very key aspect. And also acceptance is how we can provide the help and support without a judgment. I think that becomes a part of acceptance. And of course, in the awareness, we know it's how the individual is coping, but we need to see that, go a step ahead, that how we can embrace these people with autism and grow from it, and building a relationship with the people who have it. And of course, and so on. So the point is awareness is not enough. That is what we'd like to say. And we need to see that how the acceptance can be there, and we need to see a truly inclusive and a community-driven society. And of course, we know that one of the support is wearing a blue. In fact, I was happy to see just now that it was mentioned in your email. And basically, it's a kind of driving force that people how we can support and care for people, showing our solidarity in this regard. So that becomes important. And you can see me also wearing blue, and I can see Professor Anupam also wearing blue. So and many others also. And take this opportunity to provide a platform to people with autism spectrum disorder, their lived experiences, and how we can dispel the myths and reduce stigma and promote awareness for basically the advocacy part and the more inclusive society for all people with disability, including those with ASD. So just to briefly, I think all of you are aware, signs and symptoms, just to tell you that of course, it is in continuum, the cutoffs are there, having or not having. It's not a dichotomous, and we know that autism spectrum disorder, a whole lot of these conditions are there: autistic disorder, Asperger disorder, childhood disintegrative disorder, Rett disorder, pervasive developmental disorder, not otherwise specified. So these are different conditions, but now we all have been mixed, subsumed under autism spectrum disorder. And these are the early signs and symptoms of autism spectrum. I'm sure you all will be aware of that. Basically, unusual visual fixation, you can see, abnormal repetitive behavior, lack of age-appropriate sound development, and a delayed intentional communication, decreased interest in interaction, and so on. So these are important aspects. I'm not going to detail, but the point is that it may be evident as early as 6 to 12 months. By and large, 12 months to 24 months, that's a period that it becomes evident. But the important point is, if we identify early, then we can really work with these children. We can have all the techniques we can use so that the child can improve. And of course, sometimes it is because in our clinic, sometimes children come quite late also because the awareness is not there. People are not aware, especially those from remote areas and so on. So these are some of the important symptoms, and we can see the general symptoms which are there. I'm not going in detail of this, but and which we see. A lot of awareness is being created. In fact, happy to see the newspaper also sometimes these comes up, and basically now some awareness has come. But the point is that we need to reach out to people in remote areas, in rural areas, and so I understand that in metros, yes, awareness is there, but we need to go beyond major cities. That how we can reach out to people. I think that becomes important. About a few words about diagnosis and management. I think I will tell you the diagnosis criteria DSM-5. I am just giving that how it is all international classified. It's not that Indian specific. These are all international classificatory system. We have DSM means this diagnostic and statistical manual of mental disorder. We have currently 5 versions. And ICD is a WHO, International Classification of Disease. In these mental and behavioral disorders are there. And autism spectrum disorder is very much part of that. And these are some of the diagnostic tools which have been developed in a way calibrated for our own population from India. That's the inclined diagnostic tool, which we are part of that for autism spectrum disorder. We also have AIMS modified inclined tool. And we also have, because we are in our Rights of Person with Disability Act, autism is very much part of that. ESA is Indian Scale for Autism, which is there, and cutoff score of 70 is there for the benchmark disability. So these are some of the, if anyone has to be diagnosed or given a certificate, so we, as per the Gazette notification, we need to make a diagnosis on inclined tool for autism spectrum disorder, and to quantify it, or severity, we apply ESA, that is Indian Scale for Autism, and we mark the disability. So it's much easier process. So it's not anyone for which the other benefits can be given. So these are some of the important tools which are available. Now, what is important in DSM-5 is mainly the diagnosis is based on 2 areas, that is deficits in social communication and interaction. So this is one of the major criteria, and the restricted repetitive pattern of behavior, interest, and activities. So basically, this is one of the important. These are two important areas. Of course, there are other symptoms of dysfunction, and it has to be in the developmental period before the age of 3 years. I think that about more than 90% of the symptoms are there before the age of 3 years. Whenever we take history, talk to parents, it's evident before the age of 3 years. Now, this is just to give you the glimpse. Like earlier DSM-4, we have all these conditions which were there, like pervasive developmental disorder, Asperger's, autism, childhood disintegrative disorder, Rett's, and so on. So they all are subsumed under autism spectrum disorder of these two major criteria, that is social interaction, deficit in social interaction, social communication, which includes abnormalities or deficit in the social reciprocity. Reciprocity means that how we can maintain back and forth conversation, how we can share our joy, or so that pointing finger towards something, we can there is a problem or a deficit in that. And of course there is a problem related to non-verbal communication, and the body posture, the eye contact, and the tone, and so on. And of course, there are issues related to the relationship, like, not only with the development or maintenance of the relationship. So these are some of the important areas which are being disturbed. The other issue is the restricted repetitive pattern of behavior with regard to repetitive behavior, like echolalia and other flapping fingers and so on, which are there. And the disturbance in that they want to have a fixed routine, almost like a ritual way. Almost like an obsessive fixated interest may be there, or there may be a sensory issue. So these are in general briefly about the diagnosis, and which is very simple, easy to make a diagnosis, not difficult. And also I would like to tell parents or anyone, we do not require a very high-tech sophistication investigation for that. Sometimes people believe that we need to get a lot of blood tests and all for that. It's not that. You just have to talk to a parent, to the caregiver, observe a child, and talking to a person in depth, and we can make the diagnosis. Most of the time, yes, there are 10 to 20% where there are certain difficulties, but by and large, majority of them, it's easy to make a diagnosis only by observation and talking to the parents and taking a good history. Now, these are some of the tools which are there, as I was talking about, incline tool for autism spectrum disorder. These are all available in the internet website, so which again has been modified, the recent version also. Now, some of the important facts that we do not have, there is any medical or genetic test for diagnosis of autism. Of course, for a related condition like Fragile X syndrome, which may have autistic features, we do have a genetic test, but to diagnose as such autism, there is no such blood test, because sometimes we all think as a parent when they come, do you have any specific blood test? So actually there is no such blood test or brain scan or anything. If there are associated conditions, then we do ask for those tests, but by and large to make a diagnosis of autism, they are not required. And for diagnosis, of course, we need to have a specialist who have experience of working with these children. The observation is very important. Asking a family member about the development of these symptoms, where there are objective assessment. These, let me tell you, these are all international criteria to make a diagnosis. So whatever we make a criteria of autism spectrum, the same will be made in the US also. So it's like that. So these are all internationally recognized criteria. And onset, of course, 12 to 18 months, as early as we can diagnose. So and sometimes it may be delayed also. So these are some of the comorbid conditions. I'm just highlighting here that ADHD, learning disability, Tourette's, OCD, and a whole lot of conditions may have, these symptoms may be associated. Now, just briefly about the management part, I think early accurate diagnosis is important, but also I wish to tell you that in our time when we were students, the prevalence was said to be 4 or 5 per 1,000 or 10,000. So it was considered very rare condition. But now in recent time, for it is said to be as close as 1 in 100 or 1%, even lesser than that, 1 in 80. Some say in 1 in 68 also. So there are So what in a way, the condition which was so rare earlier, but now it's considered to be much more commoner than that. So the point is that if we identify early, then the intervention can be there initiated, and lot of improvement. I have seen myself the kind of improvement one can have. And which gives the optimal benefits. So noticing and developing the concern, discussing the concern with others, and accurate diagnosis, they all form the effective treatment. Now, what are the goals of intervention? So one is that we should not look for care as such. There is no definite treatment for it. You can hear me? I think there is some problem with the light here. Can everyone hear me?
Yes, we can hear you.
I think light has gone. Okay. I hope there is no light here. Okay, so we should not strive for the normality as such, and thinking of adaptation is important. How a child can adapt, and the most important, the individual needs of a child. I think that's because it cannot be blanket for all children. Sometimes we need to work towards the need of a child specifically. We need to tolerate the acceptable differences which are there. And of course, the unique contribution of some which are there, we need to accept that. So these are the management strategies which are there, like intensive behavioral and developmental intervention, and individualized plan as such based on the need of a child. And of course, speech therapy, behavior therapy, and occupational therapy is important. And I'm sure you will hear more in Dr. Mary Barua's lecture. And principle of applied behavior analysis, which again, because it's mainly it's a behavioral symptom. So by this we can improve the behavior, teaching new behavior, reducing challenging or disturbing behavior by the reinforcement technique and so on. And of course, social skill training also is important, sensory integration therapy, because there are a lot of disturbances in this different sensory areas. So sensory integration therapy is also the mainstay of the treatment. And parent training, of course, have a very positive effect. Then we all know there is no definite treatment, medicine to cure the core symptom. Again, my word here is to cure the core symptom. So there is no, because many parents ask, will there be a cure for it? So definitely, there are many conditions, there is no cure. We take care of the symptom. But there are evidence-based effective treatment available for different treatment strategies are there, where a child can learn and function efficiently, and many such activities are being done, many such therapies are being done to basically to improve the functioning of a child. And of course, there are medicine which are there to take care of the behavioral problems, that is agitation, irritability, anger, comorbid mental disorder like depression, anxiety, ADHD, and so on. For them, yes, the medicine is available, and we do give medicine to these children. And that's a part of our psychiatry practice. But the core symptom, the cure, we should not strive for it, but we need to see that how a child can function to the optimum level, how we can improve the functioning of a child. And of course, there are many such advertisements which do come, which are being offered by many people, but we see that they are not truly evidence-based treatment. So as a parent, it's important that we only need to see the evidence-based treatment, because sometimes what we have seen ourselves, that many a time, because parents are so emotionally disturbed because they go from one place to other place, wherever they are, sometimes we do have advertisement that, okay, we'll cure the child with autism. So, but we need to be very careful. We need to only see that the place where we have a evidence-based treatment. So what a parent can do, briefly we talk, because parents have an essential role always, I believe, not only for autism, but any child who have mental health issues, any child who have behavioral problem, the success of the treatment is that how a parents are able to understand, and how a parents can give a role and give a supporting how they are supporting a child with not only autism spectrum disorder or any child with a special need. So I think that becomes a very key aspect, and your role is so important. And of course, parent can help to ensure access to health services and education. Again, this is important because adult can go and seek services anytime. They can go on their own, but child is dependent on the parents and the caregivers. So again, they are the one who will take a child for the health services and the education and so on, providing a nurturing and a stimulating environment to a child. And that's the role of a parent, not only for autism, but also for any child with any behavioral issues or mental health issues. The nurturing and always we believe, even in the COVID period, we have always said, give the stimulating environment to a child. I think that becomes a very key aspect. And of course, parent can also help deliver the psychosocial behavioral treatment. I can tell you, which we also practice, that is, parents becomes a co-therapist, and there are many home-based treatments for with regard to autism, with regard to learning disorder, with regard to other children with special need, home-based treatment where parents can take a very active role and act as a co-therapist. So your role becomes very, very important. And of course, we also need to take care of our own physical and mental health. Now here I am addressing this very, very important point, and I wish to tell you, in my clinic, many parents, especially mother, are overburdened at times, emotionally exhausted, almost like a burnout symptoms with so much stress, because we need to see that we can only help others. First, we have to take care of your own self. Then only we can take care of our children, other family members. So please understand this important issue of caregiver burden or parental burden. And if there are any issues, please discuss that with your doctor, with anyone around, or as a support group. There are many support groups which are there, many associations which are there. So you need to ventilate. You need to talk about your own, stresses and difficulties. So that will reduce your anxiety and apprehension. So please take care of your own health. I wish to tell all parents, anyone who has a child with autism or any child who has special needs, please see that your health becomes because you are the nucleus of any health service provider. So please take care of yourself. So last point, again, briefly, I will just talk about this. How much more time I have? Can I take a few minutes? Yeah. Okay, so already we have heard about this, because again, since I will just, because this is a theme of this year also, that what it means is inclusive education is education which advocates that all children should study together in the neighborhood school, irrespective of the ability and disability, economic and social condition, or the family background, with all required support services which are provided by the school in collaboration with the parents. School is not just a place for learning academies. I think this we have been telling for many time now, that the school is not just for learning. I think a child learns so many skills in a school, and child spends almost 1/3 of the time in the school. So school makes a very, very important place, like a preparation of the adult life. And the classroom, we all know, child learns many life skills, like social skill. Again, we have been saying as a mental health professional, because classroom setting, a school setting is important for the social skill, learning to compromise, to bargain, to persuade others, communication, learn to get attention, asking for help, complimenting, describing, and so many things a child learns in a classroom setting. Inclusive education, again, is a process involving the genuine restructuring of the curriculum, teaching method, the classroom organization as a whole. So the important aspect is activity-based learning is well suited to include these learners with a wide variety of education needs and learning styles. Teaching material, of course, need to be adapted. Again, we need to see that they have to be adapted for our own culture, for our own language at times, which should best match the characteristic of a child and the interest of a child. And of course, it's essential to support learning by providing a multiple flexible method for both teachers' presentation as well as the opportunities for the student to display what they know or they have learned as such, And it's necessary for the teacher to learn students' communication strengths also. So it's important. It's a bilateral process. The teacher also need to learn about the students' strengths and preferences, Based on that, you will adjust your teaching method. So again, this is a very, very important aspect based on the sensory support to maximize the learning method. And of course, child with autism, the effective inclusion does not mean that you will just put a child in the regular school. The important aspect is that you are providing more option to children for structuring school in a way that every child, including those who are differentially able, can learn to reach their full potential. So that is what the idea of inclusive education is. It requires a teamwork. I think that again, we stress so much on the teamwork part, and always we believe that in a child, not only child but the parents and the family members who are there, or the maid who is there, or even the teachers, or all they play a very, very important role in that way. And so we need to have there is a need for child-friendly policy environment, supportive legislation again, which are important, appropriate accommodation need to be there. Creation of self-help groups. In the recent time, we have seen that this change as a self-help group, because that becomes a very important aspect where you all can come together, discuss your own problems and so on. And sometimes it is important to empower parents to actively participate in facilitating the child learning. Peer interaction or task-based situation are easier for children with the autism spectrum disorder. And so that becomes a very, very important aspect. And the opportunities need to be set up for appropriate and meaningful positive interaction. Again, these are important, and children with autism spectrum disorder have a distinct learning and thinking style when compared to non-autistic population. So of course, there is a misinterpretation of the behavior. Like stimming means a lot of abnormal body movements, maybe their language problem and so on. So again, they have a distinct style, so that need to be addressed. So the teacher need to be sensitized about the same, and learn more about the strategies. And again, I am emphasizing the point that teachers play a very, very major role. That first they need to understand this, then only they can deliver and really customize to the teaching methods. We all know, I think you may be aware, because this is a very important Samagra Shiksha, which is there at the Ministry of Education as an inclusive education for children with special needs. I think again, this makes our task much easier as a profession, as a mental health professional. I think because we know that education plays a very, very important role, and so of course there are support resources available for the inclusive education for children with special needs. And of course, what it means, inclusive and equitable education, provide a various kind of support. Of course, for a child with a special need, we need to address that. Since we are discussing with organized by NCERT, of course, NCERT has a lot of resource material, and which is there for children with autism. And I'm sure you will discuss all this, but I thought that I will just sensitize you to this is a very important document as such, that is including children with autism in primary classroom and so on. So I think this is very good. Of course, one can see that how it can be effectively implemented, that is to be seen, but it looks very nice, and it covers most of the points which are there. And of course, these are some of the Government of India initiatives, also Sarv Shiksha Abhiyan, which is there. CBSE also has made some changes with regard to children with disability, also including autism. Nirmaya, which is again a kind of health insurance program. Gyan Prabha is a scholarship scheme for people with developmental disability. I thought I will just tell you that these are some of the important initiatives by Government of India. So take-home messages that today's day, that is World Autism Awareness Day, it's an important day to create the opportunity as such for autism awareness and acceptance, and promote the autism acceptance. And autism is a spectrum disorder, and presentation is highly heterogeneous. Screening and diagnostic tools are important. Parents and teachers could play an important role in achieving inclusive education for children with autism and help them achieve their full potential in life. So these are my acknowledgements, and I'm happy. I have been working for many years with these, in ministries and our department, and I'm very thankful to all people. With this, I will end here. Thank you so much. I think
Thank you very much, Dr. Rajesh, for your inputs. I'm happy to share कि हमारे साथ बहुत सारे लोग जुड़ गए हैं सुबह सुबह, कई 100 लोग हमारा चैनल देख रहे हैं, और एक रिक्वेस्ट आई है कि हम अंग्रेज़ी और हिंदी दोनों में बात करें, तो अब से बाकी स्पीकर्स ये करेंगे, और उम्मीद करते हैं कि आप जुड़े रहेंगे और इस सेशंस का से सीख लेंगे. अब I have the pleasure of taking you to the next speaker who is with us and who will help us और समझने में हमें सहायता करेंगे इन बच्चों की क्या ज़रूरतें हैं और ये बच्चों के लिए हम क्या कर सकते हैं. अब मेरा ड्यूटी है कि मैं अपने नेक्स्ट स्पीकर को थोड़ा सा आपको उनके बारे में बताएं. एक्चुअली शी डजंट रियली नीड एन इंट्रोडक्शन. मेरी बरुआ, फाउंडर डायरेक्टर ऑफ AFA. शी इज़ एन एक्टिविस्ट, an educator, a trainer, and a writer who has pioneered the autism movement in our country. Her focus is on creating enabling environments for children with autism, and as she advocates for their right in education, in employment, in recreation, and civic life as equal citizens of the country. She is an Ashoka Fellow and an INSAR awardee as well, and importantly, a parent of Neeraj, who is a person with autism. Over to you, Mary ji. थोड़ा इंग्लिश और अंग्रेजी दोनों में अपनी बात को रखिए. Over to you till 11:15.
Thank you, Anupam ji. Greetings of World Autism Awareness Day to everybody, and thank you to the Department of Education and NCERT for this opportunity. I will try to share my screen. Here we are. Slideshow. Okay, and okay, I want to start by saying that this is World Autism Awareness Day, but I'm going to also take this away so that I don't get distracted. This is World Autism Awareness Day. We see it, हम इसको देखते हैं as Autism Awareness Understanding, Autism Awareness Understanding and Acceptance Month. Because खाली awareness से नहीं होता है ना. I think Dr. Rajesh Sagar talked about it also, that awareness alone is not enough. हमारे लिए understanding and acceptance बहुत ही ज़रूरी होता है. और हम अभी जो बात करेंगे, it's really along these lines. So I will start. I want to quickly say before I carry on is that, ये जो हम acceptance के बारे में बात कर रहे हैं, as an organization, Action for Autism, I think many of you will know that हम एक entire gamut of activities के ऊपर काम करते हैं. We work with children with autism, हम inclusive education में काम करते हैं, हम parents के साथ, something Dr. Sagar mentioned, parents को empower करना, to help them come out, उसका जो helpless एक feeling रहता है, उससे निकलकर change maker बन जाना, इसके ऊपर हम बहुत काम करते हैं. Of course हम professionals को train करते हैं through our B.Ed, diploma and other trainings. हम employment के ऊपर बहुत काम करते हैं. हम इसलिए बोल रहे हैं क्योंकि 30 years back जब Action for Autism start किया था, तब ज़्यादा से लोग, किसी को पता नहीं था कि autism है क्या, और कोई नाम, वो शब्द सुना था मगर उसका मतलब क्या है नहीं समझते थे. उससे अभी हम काफ़ी दूर आए हैं. So like I said, we also work on employment and competitive employment. हम एक assisted living भी run करते हैं, and we specialize in the area of autism. तो बहुत changes हुआ है, but like संतोष यादव जी ने बोले हैं, I think he's the one who said this, कि काफ़ी changes आया है, मगर it is ज़्यादा से ज़्यादा metros में limited है. Over the years हम देखे हैं, it has moved to larger towns. अभी smaller towns में भी काफ़ी awareness, थोड़ा awareness होना शुरू किया है, मगर बहुत सारा अभी जो services है, which is really based on कितना awareness creation होता है, कितना learning हमारा होता है, वो अभी भी काफ़ी rare है, छोटा छोटे जगहों में, रूरल एरियाज में, छोटा टाउन्स में, इट इज रियली स्टिल वेरी रेयर. So since I'm going to be talking about knowing autism, I thought हम शुरू करेंगे the story of सुमन. सुमन एक 6 साल की लड़की है. वो स्कूल ज्वाइन की है फर्स्ट टाइम के लिए, और सुमन बहुत ही वर्बल है, बहुत अच्छे लैंग्वेज के साथ बात कर सकती है, इंडिपेंडेंट है, शी इज टॉयलेट ट्रेन, शी डज ऑल हर एवरीडे एक्टिविटीज हरसेल्फ. तो उसको जब स्कूल में ले गया एडमिशन के लिए, वो काफ़ी आसानी से एडमिशन मिल गया. मगर कुछ दिन में ही डिफिकल्टी शुरू हुआ. क्योंकि क्या होता था कि वो क्लास में वो पैंट में अपने आप को वेट कर, शी वुड वेट हरसेल्फ, जस्ट टू पुट इट सिंपली, शी यूज्ड टू डू सुसु इन द क्लास. तो उसको, बिकॉज उसका हिंदी हमें ठीक पता नहीं, सो सुसु इन द क्लास. तो उसको स्कूल टीचर्स बहुत परेशान होते थे, पेरेंट्स को बोलते थे कि आप क्यों ऐसे बोले हैं कि वो टॉयलेट ट्रेन है. वो तो टॉयलेट ट्रेन है ही नहीं, वो पैंट में सुसु करती है. पेरेंट्स उसको घर जाकर एक्सप्लेन करती थी, सुमन कैसे, क्यों ऐसे करती है, घर में तो वो बहुत अच्छा करके टॉयलेट जाता है. सो ये स्कूल और पेरेंट्स पे काफ़ी कॉन्फ्लिक्ट शुरू होना शुरू किया. इसके वजह से सुमन ऑल्सो स्टार्टेड हैविंग बिहेवियर्स, बिकॉज दूसरे बच्चे मजाक उड़ाते थे उसका. टीचर्स भी कभी कभी काफ़ी सरकास्टिक होती थी. उसके बाद वो 2-3 स्कूल्स चेंज किया. एवरीवेयर इट वुड हैव टू से कुछ दिन रहकर देन दे वुड हैव टू मूव ऑन. इवेंचुअली वो लोग सुमन को एक डे बोर्डिंग में डाला. तो डे बोर्डिंग में भी यही प्रॉब्लम. नॉट ओनली दैट, डे बोर्डिंग में क्या होता था, क्लासेस के बाद आफ्टरनून में कुछ लंच करके दे वुड रोल आउट देयर मैट्रेसेस और पैलेट्स इन द क्लासरूम, और सबको सोना होता था. तो व्हेन दे वुड लाई डाउन, देन अगेन शी वुड वेट द पैलेट दैट शी वाज लाइंग ऑन, उसमें भी सो होता था. So this place got really angry. In the meantime, क्या हुआ? The mother, she was a very nice mother, but she was getting worried and frustrated. और जो होता है frustration से, she started hitting Suman quite a bit. बाकी earlier जो schools था, वहाँ पर भी उसके साथ काफी punishment हुआ था. और इस जगह में जब आया, यहाँ पर they would punish her, और ऐसा भी करता था. ये जो जगह पर जहाँ पर वो था, it was a place जहाँ पर काफी winter में it used to get very cold. एंड जब ये इसका ऐसे सोते वक्त आफ्टरनून रेस्ट टाइम में वो पैलेट में सुसु करता था, स्कूल क्या करता था, उसको ले जाकर ठंडा पानी से दे वुड मेक अ स्टैंड अंडर द कोल्ड शावर एज अ पनिशमेंट, राइट, टू फिक्स दिस थिंग. सो देन उसका मदर को बोल के बुलाया कि आपको कुछ करना होगा, या तो आप झूठ बोले हैं हमें कि वो टॉयलेट ट्रेन है, या तो ये जस्ट शैतानी कर रही है, आप डिसाइड करो, हमें वी डोंट नो व्हाट टू डू. इवेंचुअली ये मदर ब्रॉट हर टू अ ऑटिज्म स्पेशलिस्ट प्लेस. वहां पर व्हेन दे आस्क्ड लॉट ऑफ क्वेश्चंस, दे ट्राइड टू अंडरस्टैंड क्या होता था, एग्जैक्ट सिचुएशन में क्या होता था, एंड देन दे रियलाइज्ड कि या तो ये एक जनरलाइजेशन का डिफिकल्टी है, या तो एक कम्युनिकेशन का डिफिकल्टी है. जनरलाइजेशन का क्या डिफिकल्टी है? सिंपली दैट सुमन को पता है हमें जब सुसु आता है हम टॉयलेट चले जाते हैं, राइट. वहाँ पर मे बी उसको पता नहीं कहाँ पर टॉयलेट है, पता नहीं कैसे वहाँ पर जाना है, इसलिए वो नहीं जाता है. एक स्किल जो घर में जानता है, उस स्किल को स्कूल एनवायरनमेंट में मदर के साथ जो करता है, टीचर के साथ जनरलाइज करना कि हम टॉयलेट चले जाए. शी डिड नॉट नो कहाँ पर है, कैसे जाना है. दैट्स वन एस्पेक्ट. द अदर वाज कम्युनिकेशन. सुमन इज वेरी फ्लुएंट इन कम्युनिकेशन. उसका लैंग्वेज बहुत ही अच्छा है, राइट, बट शी हैज ऑटिज्म ऑल्सो, राइट. एंड द थिंग इज कि जस्ट बिकॉज उसका कम्युनिकेशन है, उसका मतलब ये नहीं कि वो बोल सकेगा आई नीड टू गो टू द टॉयलेट, या पूछ सकेगा मैम मे आई गो टू द टॉयलेट. एंड दैट इज बिकॉज शी हैज ऑटिज्म. एंड व्हाट वी डिस्कवर, what the specialist place realized was this was the difficulty जो सुमन के साथ हो रहा था. वो बहुत अच्छा बोल सकती है, मगर and toilet trained है, मगर despite that she could not say ma'am I want to go to the toilet. क्लास में उठकर जैसे जाती थी, टीचर would say क्या कर रहे हो, sit down, stop walking around the class. यहाँ पर भी वैसा होना शुरू किया. कभी कभी ब्रेक में चली जाती थी तो टॉयलेट एक्सीडेंट नहीं होगा, मगर क्लास के बीच में जैसे जाने का शुरू करती है, टीचर वुड टेल हर टू सिट डाउन, and she would not be able to say that I need to be excused, I need to go to the toilet, may I be excused, any of the things though that children say, I need to go to the washroom. And that is what autism is. We have people who very जिसको हम बोलते हैं able people, जिसको हम बोलते हैं Asperger's syndrome, बहुत अच्छा काम करता है, मगर टीचर को समझ में नहीं आता है कि क्यों ये पेपर खत्म क्यों नहीं करता है. बिकॉज जब उसको एक क्वेश्चन दिया गया है, 3 क्वेश्चन में एक में कहीं पर क्लास वर्क में स्टक हो गया है, ही इज नॉट एबल टू से सर आई नीड हेल्प, एंड यू हैव टू गिव देम द टूल्स टू बी एबल टू डू दैट. बट व्हेन डू वी गिव द टूल्स? व्हेन वी रियली अंडरस्टैंड. जब हमें ऑटिज्म का उसका समझ नहीं रहता है, तब क्या होता है? बिहेवियर्स होता है. बिहेवियर्स ऐसे नहीं आता है, बिहेवियर्स आता है बिकॉज वी डोंट अंडरस्टैंड. और जब बिहेवियर्स आता है, हम क्या बोलते हैं? दे आर पीपल हु आर अग्रेसिव, दे आर वायलेंट, दे हैव चैलेंजिंग बिहेवियर्स, दे आर डिसोबीडियंट, दे आर प्रॉब्लमैटिक. और ये क्यों होता है? बिकॉज वी व्यू पीपल विद ऑटिज्म फ्रॉम अ न्यूरोटिपिकल अंडरस्टैंडिंग. हम उसको एक बहुत न्यूरोटिपिकल लेंस से देखते हैं. जब तक हम उसको न्यूरोटिपिकल, दैट मीन्स ऑल ऑफ अस हु आर नॉट ऑटिस्टिक, पीपल हु आर ब्लाइंड हैव न्यूरोटिपिकल ब्रेन्स, पीपल हु हैव इंटेलेक्चुअल इम्पेयरमेंट हैव न्यूरोटिपिकल ब्रेन्स, राइट? पीपल विद ऑटिज्म डू नॉट हैव न्यूरोटिपिकल ब्रेन्स. तो हम बहुत न्यूरोटिपिकल अंडरस्टैंडिंग से देखते हैं, और न्यूरोटिपिकल अंडरस्टैंडिंग से डिजायरेबल बिहेवियर, कौन सा बिहेवियर हम अच्छा है, कौन सा बिहेवियर बुरा है, हम ऐसे सोचते हैं, राइट? And I'll just give you a little example. I don't know कितना time है. Supposing if I had a visitor, I had a young man who's come to visit me with his family from, let's say, the US, right? A white American who's come from the US. वो जब हमारे घर में बैठ के बात करेगा, he will cross his legs और उसका पैर उसका अपना फादर की तरफ pointed रहेगा, right? हमारे दिमाग में आएगा कितना बुरा लड़का है, कैसे बैठा है, उसका पैर उसके फादर की तरह है. बट इन मोस्ट ऑफ द वर्ल्ड, अपार्ट फ्रॉम सम ऑफ द ईस्टर्न पार्ट्स, पैर किसी की तरह दिखाना इट इज नॉट सीन एज अ बैड थिंग. हमारे कल्चर में, इन आवर कल्चर, व्हेन वी हैव आवर फीट पॉइंटेड एट आवर पेरेंट्स, लोग क्या बोलते हैं? वैसे मत बैठो, पैर नीचे करो. बिकॉज इट्स अ डिफरेंट कल्चर. ऑटिज्म इज अ डिफरेंट कल्चर. ऑटिज्म एक अलग कल्चर है, राइट? इसका ये एक न्यूरो डाइवर्स वे ऑफ लिविंग है. और जब हम उन लोगों को देखेंगे, हमें उस लेंस से देखना होगा, एंड नॉट लुक एट इट फ्रॉम दिस जो हमारे किताबों में लिखा रहता है ना. जब हम पढ़ते हैं, इट कीप्स सेइंग इम्पेयरमेंट्स, impairment in this, impairment in that. It is not a question of impairment. It's a question of being different. It is not because तब क्या होता है, हम जब ऐसे as teachers, I'm not diagnosing the child, I'm a teacher. As a teacher, I have to shift my lens from this kind of a deficit orientation. हम जितना time deficit orientation से देखेंगे, I will not be able to do much. I have to shift my viewpoint, move from a deficit orientation to a rights orientation, to a strengths-based orientation, because the child with the most what we call severe autism also has many strengths. तो जब तक हम ये deficit orientation से रहेंगे ना, हमारा बहुत सारा assumptions रहेगा. Sorry. So for instance, हमारे क्लास में एक लड़का है जो हर भागता दौड़ता है. He's come to school for the first time, नर्सरी में है, 4 साल का है. He's running around. So हमारा first क्या thought होगा, कैसा लड़का है? And I'm quoting things that teachers have told us. He's a really bad student. कभी सुनता नहीं है, भागता दौड़ता है. काफी टीचर आके बोलता है ये बहुत hyperactive है. Yes, hyperactivity does come with autism, but only sometimes. But in most of the kids with autism, parents भी आकर बोलते हैं बहुत hyperactive है. And that is because we are looking at them from a very deficit-oriented, neurotypical lens. हमें सोचना होगा, why is this child jumping? इसका reasons क्या हो सकता है? Because if the kid has autism, maybe ये दौड़ रहा, भाग रहा है, because इसको ये जो toys हम दिए हैं, it doesn't make any sense to him. He likes toys that are like puzzles. He likes a toy that is a block. ये जो cooking set दिए हैं, it doesn't make any sense to him. It's of no interest to him. तो वो puzzle 2 बार किया और कितना करेगा? Same puzzle. Now he's running around. He does not know अपने आप को कैसे occupy करना. उसको पता नहीं अपने आप को कैसे occupy करे. Right? With जो उसको सामान दिया गया है, तो वो क्या करता है? वो भाग रहा है, क्योंकि और तो उसको करने का है नहीं. या तो हो सकता है उसका एक vestibular need है. उसका vestibular need है, इसीलिए he needs to keep jumping. तो जब उसको पता नहीं टॉयज से क्या करना है, तब टीचर को सोचना है कैसा टॉयज दे या इस टॉयज से कैसे उसको ऑक्यूपाई रखे. उसका वेस्टिब्यूलर नीड है, तो तब टीचर को क्या सोचता है? मे बी उसको क्लास शुरू होने से पहले 5 मिनट एक ट्रैम्पोलिन में दे दे, या तो उसके साथ साथ एक क्लास से दूसरे क्लास के बीच में और 2 मिनट ट्रैम्पोलिन में दे दे. जैसे उसका जो वेस्टिब्यूलर नीड है, that is taken care of. Different kids will have different ways of taking care of that. But if I'm a teacher and I'm trying to understand the child and understand autism, then I will think कि this is not bad behavior. हो सकता है ये जो running around कर रहा है ना, this extreme running around, maybe the child is feeling very anxious because everything is so different and new for him. Maybe anxious for other reasons. And if the child is feeling anxious, if उसका कारण भी हमें समझ में नहीं आया है, उसका एंजाइटी के डील करने के लिए हम लोग बहुत कुछ करते हैं. कुछ लोग हैं जब एंशियस फील करते हैं, लेग को बहुत शेक करते हैं. हम में है, न्यूरोटिपिकल लोगों में हम लेग को बहुत शेक करते हैं. कुछ लोग हैं ऐसे करते हैं, नेल्स को बाइट करते हैं. Some autistic children will need to run around. We need to give them something to deal with that anxiety. Some will rock. हम उसको कोई fidget toys दे सकते हैं. Maybe they can have a fidget toy that they can keep themselves calm with, right? It could be a slinky. Maybe हम class में, in a junior class, I can put an old carton, उसके अंदर सामने कट कर 2 cushion डाल दे. So not just the autistic kid, any child who's feeling anxious can go and sit inside that and calm. It's like a little calming space. The problem is that in our country, हम सोचते हैं क्लास में ऐसा होना है. But in a really inclusive school, we think of all kinds of children, even neurotypical children who are feeling anxious. क्योंकि कोई neurotypical बच्चे का भी घर में कुछ हुआ है, जिसके वजह से वो शायद anxiety feel करता है. And we don't have any ways of helping them deal with that anxiety. So we have to think, what is it that is really happening? Not make assumptions. Not make an assumption कि ओ ये तो बस ऐसा ही है, ये तो impairment है, इसीलिए ये नहीं कर सकता है. Try to understand why, and also understand that people with autism, when they do things, they are not more or less. They are just different. And that is the meaning of neurodiversity that Dr. Rajesh Sagar referred to. हम जब neurodiversity के बारे में बात कर रहे हैं, that is a critical part of inclusive education and inclusion broadly. Because inclusion बोलता क्या? That we are inclusive of everything. We are inclusive of every kind of diversity. And that is what neurodiversity is all about. जहाँ पर हम सबको अपने साथ लेकर चलते हैं. नहीं बोलते हैं कि इसका ये डिसेबिलिटी है, उसका वो कलर है, उसका ये रिलीजन है, उसका वो कास्ट है, इसका ये पैसे का फर्क है. We don't look at that. We look at every kind of diversity and make them a part of the whole. And that is really what neurodiversity is all about. और जब हम autism के बारे में बात करते हैं, हमें याद रखना है कि जब हम ये behaviors आता है क्योंकि हम environment उसके लिए नहीं बनाते हैं. The environment that we provide is not really meant for them. हमें सोचता है कि उसका लिए what would be the best environment for somebody जिसका for instance understanding, where did I go? Sorry, this keeps going. Whether it can be there, it doesn't matter. Whether understanding is very literal. तो हम उसके साथ कैसे बात करते हैं? हम जानते हैं, किताब में पढ़े हैं that the understanding is very literal. उसका communication में लिखा है understanding is very literal. But what does that mean? It means कि I have to speak to them in a very literal language. हम तब बहुत सारे metaphors, at least early learners के लिए, as they get older, they pick up on these things and they learn to adapt to some of them. But definitely for early learners and even later on, हमें language को बहुत literal and direct रखना है. I will not use sarcasm. I would not use, or even, like supposing एक बच्चा बहुत आस्ते आस्ते लिख रहा है, is taking a lot of time to read, right? और टीचर आकर बोलता है, अभी भी इस क्वेश्चन में हो, pick up the pace. उसके बाद टीचर तो चला गया, मगर ये बच्चा जब pick up the pace सुना, वो जमीन में अब पूरा the rest of the period वो ढूंढता रहेगा, pace कहाँ है जिसको हमें उठाना है. I have to pick up the pace. So I have to use very direct language if I have autistic kids in my class. That benefits not just autistic kids. It benefits kids with learning disabilities. It benefits kids with intellectual disability. It also, in the early stages, benefits a lot of the kids with hearing impairment, with other kind of needs as well. So keeping my language very direct will help them. Remembering that हमारा जो autistic student है, उसका maybe context लेकर difficulty है. क्योंकि context जो shift होता है, they would have a difficulty. और ये शैतानी नहीं है. तो for instance, to think of an example. Okay, so अब जब बच्चे स्कूल में आने से पहले घर पे पेरेंट उसके साथ बहुत काम करते हैं, तो पेरेंट इंस्ट्रक्शन देता है, क्वेश्चन पूछता है, राइट? तो वो बच्चा क्वेश्चन का तुरंत आंसर देता है, एंड द पेरेंट सेज, सो टेल मी व्हाट कलर इज दिस, वो आंसर देता है. सो हु वाज सो एंड सोज फादर, आंसर देता है. सो द मदर आस्क्ड द क्वेश्चन, बच्चा तुरंत आंसर दे रहा है. मगर हम जब स्कूल में आए हैं, जब कॉन्टेक्स्ट शिफ्ट हो गया है, तब क्या होता है? जब टीचर जैसे क्वेश्चन पूछता है, are we supposed to instantly answer or are we supposed to do this? Context has changed. And for the autistic child to get that now, I can't give an answer immediately. और बहुत क्लास में है जहाँ पर immediate answer नहीं दे सकते हो. Maybe English क्लास में हो सकता है, मगर मैथ क्लास में चेंज हो जाता है. क्यों? मैथ टीचर मांगती है हम ये करें. So for them to get that shifted context can be difficult. जब वो out of turn answer कर रहा है, are they being deliberately difficult? Are they being disobedient? Are they being disruptive? No, they simply have autism. और हमें समझना है क्यों ये बच्चा ऐसा करता है. उसका सेंसरी नीड समझना जरूरी है. ये ध्यान में रखना है कि they experience the world, the sensory world, in a very बहुत ही deep और intense way में. हमारा नेक्स्ट क्लास में कौन संतरा खा रहा है, I have no idea. But if I'm an autistic kid sitting here, I can smell the santra. And if I have difficulty with the sense of smell of santra, I would have difficulty focusing teacher क्या बोल रहा है, because उस क्लास में एक संतरा पीला नहीं पील किया जा रहा है, right? So I have to keep all this in mind. Maybe the rest of the school is fine with the sounds from the rasta se. Class का किसी का कोई difficulty नहीं है. But maybe the autistic kid has a difficulty. नीचे जो traffic sounds आ रहा है और उसका difficulty है, तो उसको एक earphones देने, if he wants it, देने में क्या problem है, right? या तो उसको खिड़की से थोड़ा दूर बैठाने में क्या problem है? But ये हम कर सकते हैं, एक तो समझें, and उसके बाद I use my empathy, because empathy is something that is to remember that they experience differently. And I wanted to show you this visual. जब हम autistic बच्चों को देखते हैं ना, हम उसको just behaviors देखते हैं, सामने जो देखते हैं ये एक लड़का या लड़की आई है जो बाकी बच्चों से तो कोई ही फर्क नहीं है, ये तो एक ही है. और उसका जब बिहेवियर्स होता है, तब हम भूल जाते हैं कि आइसबर्ग में जैसे एक खाली 1/10 ऑफ द आइस ऊपर है, नीचे जो उसका 10 गुना या ज़्यादा आइस है, हम उसके बारे में नहीं सोचते हैं. We only see that ice on top. यदि टाइटैनिक को ध्यान रखता था कि सामने ये आइस है मगर नीचे 10 times है, we have to be really careful. Maybe Titanic would not have happened. तो ऑटिज्म में यही होता है, हम भूल जाते हैं कि एक आइसबर्ग हमें दिखाई दे रहा है, वो आइसबर्ग ऊपर में जो है दिखाई दे रहा है, नीचे जो है it is 10 to 15 times more, and that is what we have to understand. We have to understand that these are people who think differently. See, autism means this is a person who जो दुनिया को एक्सपीरियंस करता है एक अलग तरीके से, दुनिया को प्रोसेस करता है एक अलग तरीके से, और दुनिया के साथ इंटरैक्ट करता है एक बहुत ही अलग तरीके से. डिफिकल्टी आता है बिकॉज दे लुक द सेम, उसको देखने में एक ही लगता है, इसीलिए वी आर ट्राइंग टू ऑलवेज फिक्स देम एंड क्योर देम. एंड डॉक्टर सागर सेड फॉरगेट अबाउट क्योरिंग, उसको क्योर करने का बात भूल जाओ. इंस्टेड व्हाट डू वी हैव टू डू? वी हैव टू अंडरस्टैंड एंड वी हैव टू एम्पथाइज. और एक चीज किताबों में, स्पेशली पुराना किताबों में बहुत लिखा जाता था, वाज दैट ऑटिस्टिक पीपल लैक एम्पैथी. और हमें अभी पता है कि दे डोंट लैक एम्पैथी. ऑटिस्टिक पीपल हैव एज मच एम्पैथी एज यू और आई डू, मगर उसका अंडरस्टैंडिंग ऑफ द वर्ल्ड, इट्स अ डिफरेंट कल्चर. ऑटिस्टिक कल्चर अलग है, वो ऑटिस्टिक कल्चर के हिसाब से एम्पैथाइज कर सकता है. हमारे दुनिया के साथ एम्पैथाइज करने के लिए उसको सीखना है. एट द सेम टाइम वी टीचर्स एंड पेरेंट्स, हम न्यूरोटिपिकल हैं, हमें ऑटिस्टिक लोगों के साथ एम्पैथाइज करना है, जो हम नहीं करते हैं. हम बोलते रहते हैं कि ओ उन लोग में एम्पैथी नहीं है, हम कभी एम्पैथी नहीं दिखाते हैं फॉर द ऑटिस्टिक एक्सपीरियंस. जो ऑटिस्टिक एक्सपीरियंस है उसके साथ क्या हम एम्पैथाइज करते हैं? नो, वी जज. हम बहुत जल्दी जज करते हैं एज बैड, एज डिफरेंट, लाइक जजिंग दैट अमेरिकन बॉय जो पैर उठा के बैठा है, कितना गंदा लड़का है. वो गंदा नहीं है, he comes from a different culture. और उसी तरीके से हमें समझना है that autistic people come from a different culture, and as teachers and also as importantly if not more as parents, we have to learn to empathize with that culture.
Mary Barwaji, sorry, I hate doing what I'm doing, but kindly back it up.
Okay, all right. So we have to empathize with them. And when we are doing that, we have to remember that one of the things that they need most, हम जब इस empathy से आते हैं, is that they have to be given what we call visual strategies. If a child is being constantly punished, हाथ में साबुन नहीं लगाने के लिए, उसको बार-बार punish करने के बदले, if I put a visual strategy, that child knows what to do. And that is really what we have to focus on. Move away from a focus of trying to fix them or normal करने के लिए, and move to provide them with the tools and assistive supports जो उनके लिए ज़रूरत है to navigate the world. Just the way कुछ लोग को wheelchairs चाहिए, कुछ लोग को चश्मा चाहिए, जिसके without वो function नहीं कर सकते हैं. Autistic people need visual strategies, and ये भी हमको याद, I've got 2 more slides I'll quickly go through. ये याद रखना है कि as teachers that got shifted out, many autistic people stim. वो जो stim करता है, this stim, just self-stimulatory behaviors, those are because they need to do that. Those are because they're either dealing with anxiety or they're dealing with something in their body, and they need to do that. हमें उसके लिए stop करने के बदले हमें alternatives देना ज़रूरी है. Go away from forcing the child to giving eye contact. Kids with autism need to look away and to be able to focus on what is being said and to process or respond करने के लिए. उसके लिए उसको looking away करना बहुत ही ज़रूरी है. तो ये eye contact के ऊपर जो हम करते हैं, take it away. And remember, they love routines. Provide them the routines so that we are able to give them an inclusive environment. Inclusion एक attitude है, right? It is not something that we can just say कि ये करेंगे वो करेंगे. हमारा thought process and attitude हमको change करना है, and when we do that, we will stop trying to cure them, उसको ठीक करना stop करके हम environment को change करने का कोशिश करेंगे. हम वो square peg को beat कर एक गोल बनाने के बदले हम कोशिश करेंगे कि वो जो होल है ना उसको भी square बना दें. And when we do that, we will be making the world a more inclusive place, the classrooms more inclusive classrooms, and we will really be including people with autism. And finally, most importantly, abhi time hua hai to listen to autistic voices. कि what are autistic people saying? वो हमें सुनना बहुत ही ज़रूरी है. And maybe next year we will have more autistic voices speaking at events like this. Thank you so much.
Thank you very much indeed, Mary Ji. We look forward to more voices, as you said at the end. Each year, let's hope that we add on to the voices in order to understand these children better. I now go to the next session, which is more or less covered in the previous session as well. We will focus now on teaching the child with autism. And for this session, I have a special educator, Birinder Kalra, who is a coordinator at the Blue Room Vasant Valley School, and a colleague at NCERT, Dr. Bharti, who is the head of the Department of ICT and Training at CIT NCERT. So I begin by requesting Birinder ji to start. Let me give you थोड़ा सा इनके बारे में बताऊं. जैसे मैंने कहा, ये स्पेशल एडुकेटर हैं और सुपरवाइज करती हैं कोऑर्डिनेटिंग टीम्स ऑफ स्पेशल एडुकेटर्स को, जो स्पीच थेरेपी, ऑक्यूपेशनल थेरेपी एंड फिजिकल थेरेपी देते हैं ब्लू रूम, जो एक अर्ली इंटरवेंशन प्रोग्राम है वसंत वैली स्कूल में. Assessment, designing the intervention curriculum for each student based on their current levels, needs and abilities in all areas is something that Birinder's focuses on, and designing home programs for each child so that the therapy that is given in the school can be continued at home for better results. Staff training and also parent and home training is her focus. She is a postgraduate and a trained teacher from the Lady Evan College in New Delhi. So with this brief introduction, I hand over to Birinder for sharing her thoughts and helping us in, after having known our learner, let's see how we can teach the child with autism. Over to you, Birinder.
Good afternoon, everybody. Namaste. I feel really lucky कि मेरा session immediately after this हुआ है. A lot for all that you have said. It has actually paved way for what I want to say next about inclusion as an attitude. You've already spoken about a lot of strategies that can be happening in class for children, but I really wanted today, because मेरे को जो forum दिया गया है about autism and inclusion, आज हम उसका बारे में बात कर रहे हैं. So here is a short presentation. I'll try to stick to 20 minutes of my time given. आप किसी तरह का inclusion करने के लिए for children with special needs and children with autism, we have to first understand the word inclusion. The word inclusion means different things to different people. For some, inclusion का मोटा-मोटा basic meaning होता है एक child with autism को mainstream classroom में डाल दो and just hope that the child will be attended to within the operating systems at the school without any special provisions made for their diverse needs. ये approach काफी ही futile approach है. इससे हमें, अगर हम inclusion in real letter and spirit achieve करना चाहते हैं तो वो हम नहीं मिल पाएगा हमें, simply because it does not cater to the diverse needs of the child with autism. Like Miss Mary Barua rightly pointed out, a child with autism is just different. It's not that he's a pagal or he has or he's aggressive or he's this or he's that. He's just different. Like you are different from me. He's different from us, or he's different from, the other child with autism. So a generic approach to autism inclusion does not work because we're not catering to the individual needs of that child. So what is the disadvantage of this generic type of inclusion? By simply placing a child with a diagnosis of autism into a mainstream classroom in the name of inclusion, without the support he or she needs, we are actually widening the gaps and we are causing what we call environmentally mediated delays. हमारा एनवायरनमेंट भी ऐसा हो गया है कि जो उस बच्चे को उसकी नीड्स हैं हम उसको केटर नहीं कर रहे हैं और हम उसका गैप और बढ़ाते चले जा रहे हैं. Why I say so? The time that the child sits physically, he spends just physically sitting in your mainstream classroom or roaming around in the classroom without special support should ideally have been the hours the child received necessary autism specific intervention services within the constructs of inclusion. So we come to the next slide. So फिर असली में inclusion है क्या? What do you mean when we say that I am a Vasant Valley inclusive school? So I basically right now I'm representing Vasant Valley. I've been working with Vasant Valley School in New Delhi for the last 21 years. I feel it's a pioneer school in the field of education and inclusive education because we've been doing it since the day the school was started some 31 years back. So inclusion in letter and spirit accepts each child as different from the other. Neurotypical children, more or less एक ही growth curve पे होते हैं, more or less. हर बच्चे में थोड़े ऊपर नीचे होता है, but neurotypical children usually grow and develop within a specific typical milestone range and have similar growth curves. Which is why हम लोग एक neurotypical classroom में 30 बच्चे को या 50 बच्चों को एक साथ बिठा सकते हैं और एक ही टीचर, एक ही सब्जेक्ट टीचर same content पढ़ा के they are able to achieve the standardized results. However, children with autism have a wide range of differences in their development and each child is on a developmental curve different from the other with the same diagnosis. This then calls for programs at schools to be designed specific to a child with autism. So then again we come back to what is the best practice model of inclusion. Across the world now, the mandate for children with special needs is to have access to education in a least restrictive environment. And of the world over, this is being interpreted as education in a general classroom. कि आप children with autism को general classroom में डालिए and everything will work out on its own. No, everything will not work out on its own. It is important to bear in mind that a general education classroom with its demand and expectations are often a very rather restrictive environment for a child with autism. Thus, then, what do we need? The best formula for inclusion and perhaps the more compassionate one, what Ms. Barua has also emphasized again and again in her presentation, is to each according to his needs. Let me go to the next slide. How do we at Vasant Valley define inclusion? So I can give you an example of what we do. Inclusion for us at Vasant Valley is the total integration of a student with autism into the general education program with special support and all necessary adaptations needed. Ms. Barua again has given us several examples of all the adaptations that we can do for a child in the classroom. The key word here is support and adaptations, with support and adaptations, not just putting them into a mainstream classroom and saying कि हमने एक child with autism का inclusion कर दिया है. No. I'm sorry, but my slides. Okay. So what are the types of adaptations we are talking about here? We have curricular adaptations for our students with autism sitting with us in our neurotypical classrooms. We have instructional adaptations and we also have ecological adaptations. So what do we mean by curricular adaptations? We adapt what we teach. The curriculum has to be really, really specific to the child. How do we teach it? Do we teach it the same way a regular teacher is teaching? Maybe for some concepts a child with autism will get it. But maybe कुछ concepts के लिए आपको अपने teaching strategies को, अपने teaching method को, अपने teaching environment को change और modify करना पड़ेगा. So instructional strategies have to be adapted. How is the learning demonstrated? Who will teach this to the child? And how will we assess? Will we use the same assessment criterion what we do for the 35 children with the so-called neurotypical standards of evaluation? No. Again, we have to generate assessment criteria that is true to that particular child's needs and program. And we also need to make adaptations in the ecological setup, which is where will the child work, when and with who? Will he sit in the classroom with both the class teacher and the special educator? Would he need to be sitting in a remedial classroom for some part of the day to get intensive work? Will it be the OT room to achieve more OT services that he really, really needs? And the other support that we need to give to all children with special needs and particularly autism sitting in the classrooms are, systemic support, infrastructural support, family and parent support, and educational support. You know, the slide is very self-explanatory. Systemic support, jo aapke school ki philosophy has to be rooted in the principles of inclusion, without prejudice, without bias, for all children attending the school. Infrastructural support, the adaptations made in its entire infrastructure, whether it be ramps, whether it be chaude darwaze, whether it be adaptive toilets, adaptive furniture. You know, a lot of my children with autism who are sitting in the mainstream classroom, हमने उनको एक simply एक big therapy ball दिया है बैठने के लिए. जैसे Miss Barua ने बोला, a lot of times a child may have a vestibular need or a proprioceptive need. So here, sit on the ball and do your work. That small change of just sitting on a therapy ball and bouncing and while working in the classroom solves so many things. It could be giving them iPads or other tablets to loaded with, you know, communication apps like Avaz or Loco to help them communicate, especially the ones who are maybe non-verbal or have limited verbal capacities. Family and parent support. We cannot do anything constructive for a child with autism and special needs without walking hand in hand with the parents, because they are the primary caregivers. They are the ones who see the child 24 hours a day. They are the ones who are going to take care of this child for life and beyond. So we really have to take them hand in hand. We have to give value to their suggestions. We have to take all their suggestions and then come up with an IEP, which is the educational support. A team of special educators, occupational therapists, physical therapists, speech therapists, you know, have to work together to implement what is called the individual educational plan of the child. This is a quick diagram to just show you how all this has to work together for a child with autism, for real inclusion to really happen. So just a minor, you know, detail on what is an IEP. The foundation of our successful inclusive program lies in the Iep document. It's literally like a cornerstone that covers every aspect of the child's program within the school. The individualized structural plan covers all aspects of development of a child and is centered around the child's strengths, skills, areas of interest, in addition to addressing the learning gaps. This document is designed in close consult with the family and gives priority to their goals for the child. This is I hope I've covered the previous one. So what does a day of, let's say, a child with autism included in the inclusive setup of our school look like? So for example, this is class 2A and there are 3 children with special needs in this classroom. He or she is with the dedicated special educator in the classroom, in the mainstream classroom, yet in one of the sessions, you know, she's going out for an OT session for one-on-one therapy in the OT needs. In another session, if you see in lesson 5, you know, she's moving out for a language therapy session to give her intense therapy for communicating, for building language skills. This enables her again to come back to a group of peers, to a group of teachers, to a bigger group of children and be able to better communicate with them. Okay. Before I end, I hope I'm able to do this within 20 minutes. I want to give a quick word of caution on inclusion. Not every child will benefit from inclusion. Very young children will need early intervention to improve prognosis. Children who need custodial care will benefit from an intensive program over inclusion, especially in the early years. Inclusion needs to be a systemic process and not just limited to schooling procedures. Inclusion in the neighborhood, community, school, colleges, and workspace needs attention too. Inclusion to start as early as possible. So I really suggest, and I really hope that, you know, we can really start inclusion right from a day a child enters the Anganwadi. You know, right when the parent goes sarkari aspatal mein to the general practitioner. The general practitioners really need to be trained to spot the early signs of delay, so that we're able to start successful, you know, intervention strategies from a very young age to include and to improve their prognosis and help them inclusion in the coming years of life. And we definitely need to create more institutions of higher education all over the country in the field of special education to train quality manpower. So this is my presentation of how we see inclusion of kids with special needs within a school setup. I'm open to any questions if I still have some time left. Professor Ahuja?
This was very stimulating indeed to hear the voice of a practitioner. And we will now go to our next speaker, Dr. Bharti. As I said, she's the head of Department of ICT and Training at CIT. Dr. Bharti has worked in the area of inclusive education for more than 15 years now and has taken up many different projects working for the cause. She's a PhD in education from the Central Institute of Education, University of Delhi, and she some of her recent work includes preparing guidelines for inclusive pre-service teacher education and making helping teachers think about how they can make their science classrooms more inclusive. Dr. Sagar had showed the cover of one of the books that she has worked on, which is a handbook for including children with autism in inclusive classrooms. She's currently working on a screening checklist for all the 21 disability conditions recognized by the RPWD Act 2016. As a colleague of mine, I can go on talking about what she has done, but in all fairness, I will stop here to say that her books and her publications give us a lot to think about and reflect about, and the work that she is doing is really something that we need to use in inclusive classrooms, including the conversion of primary level mathematics textbooks into audio formats and also in sign language. So over to you, Dr. Bharti, for your thoughts on how we can teach children in regular classrooms. तो अब आप अपना thoughts share करिए सबके साथ. Thank you.
Thank you, Anupam ma'am. Hope I am audible.
Yes, you are audible.
And my presentation is visible?
Yes, that's visible as well.
Okay. Thank you, ma'am, for confirming. So, and welcome everyone for this very important half-day workshop. और जैसा कि आप लोग बहुत enthusiastically participate भी कर रहे हैं YouTube चैनल पे सबके comments and everything I was reading. And अब क्योंकि मेरे से पहले 3 लोग बोल चुके हैं तो मेरा काम more or less बहुत आसान हो गया है क्योंकि theoretical aspects के बारे में हम बात कर चुके हैं. हम बात कर चुके हैं कि autism क्या है, autism के behavioral manifestations क्या हैं, या ऑटिस्टिक बच्चे जो हैं वो बाकी बच्चों से किस तरह से अलग बिहेवियर करते हैं, नहीं करते हैं, किन सिचुएशंस में करते हैं, तो इन सब पर बातचीत हो चुकी है. तो इसीलिए मेरा काम कंपैरेटिवली थोड़ा आसान है क्योंकि बाकी स्पीकर्स बहुत विस्तार से इसके बारे में बात कर चुके हैं. बट नॉनदलेस कुछ चीज़ें हैं जिन पर हम थोड़ा सा फिर से ध्यान देने की कोशिश करते हैं एंड लेट्स सी कि ये सब क्या है. जब हम क्लासरूम्स की बात करते हैं और हम बात करते हैं स्वलीनता यानी ऑटिज्म वाले बच्चों की, तो ऐसे क्या कंसर्न्स हैं हमारी क्लासरूम्स में जिन पर हमें फोकस करने की ज़रूरत है. तो उसमें से पहला कुछ कंसर्न्स मैंने यहाँ स्क्रीन पर लिखे हैं जिसमें है कि क्लासरूम रूल्स के बारे में बच्चों को हम कैसे समझाएं. जब हम कहते हैं क्लासरूम रूल्स के बारे में बच्चों को कैसे समझाएं तो वो सभी के लिए तो लागू है ही है. जो हमारी समावेशी इंक्लूसिव कक्षाओं में बच्चे बैठे हैं उन तक हम अपनी कक्षा के नियमों को कैसे पहुंचाएं, लेकिन साथ ही साथ यह भी जरूरी है कि वो जो बच्चा स्वलीनता वाला है उस तक हम अपने क्लासरूम्स के रूल्स को कैसे पहुंचाएं.
Bharti, just put your slides on full screen, please.
Yes, ma'am, I'm trying. Just trying. Ma'am, can I go on like this because not able to do, there is some...
Okay, carry on.
Thank you. Okay, so there are other concerns in the classroom like sitting, answering questions, participating in classroom activities, how to participate in assembly, and how to manage the material and the time, and above all, how to stay motivated for teaching learning activities and participation in the classrooms. So all these concerns will discuss what are the strategies that may prove beneficial in inclusive classrooms when we have child with autism sitting in front of us. अब जैसे बाकी सभी लोगों ने भी कहा कि चिल्ड्रन विद ऑटिज्म इस तरह से बिहेव करते हैं और इस तरह से दिखते हैं कि उनमें और बाकी बच्चों में हमें कोई अंतर यूजुअली नहीं दिखाई देता, लेकिन जब भी हम इम्पेयरमेंट्स, डिसेबिलिटीज, विकलांगता, दिव्यांगता की बात करते हैं तो हमारे दिमाग में हमेशा एक थॉट आता है कि क्या इन बच्चों को हमें हमेशा हेल्प करने की ज़रूरत है, क्या कोई ऐसा तरीका हो सकता है कि हम इन बच्चों की स्ट्रेंथ के बारे में फोकस करें। जैसे मेरे प्रीवियस स्पीकर्स ने भी कहा है कि हमें स्ट्रेंथ, हमें डेफिसिट पर ध्यान नहीं देना है, हमें स्ट्रेंथ एंड एबिलिटीज पर ध्यान देना है। सो व्हाट आर द स्ट्रेंथ्स ऑफ चाइल्ड विद ऑटिज्म? The strengths of a child with autism are appearing on the screen, and it includes they have good visual memories. That means अगर आप उनको कुछ भी सिखाना चाहते हैं तो अगर वो पिक्चर सपोर्ट, विजुअल सपोर्ट के थ्रू दिखाएंगे, सिखाएंगे तो बहुत अच्छे चांसेस हैं कि वो उसको बहुत जल्दी पिकअप करेंगे क्योंकि उनका स्ट्रेंथ लाइज देयर। Then they learn very quickly through experiences. Hands-on experience देना जरूरी है, पर साथ ही यह भी ध्यान रखना जरूरी है कि जो मटेरियल आप एक्सपीरियंस के लिए दे रहे हैं उसमें से कोई ऐसा मटेरियल तो नहीं है जो उनकी सेंसरी सेंसिटिविटीज को बढ़ा देगा, कुछ ऐसा मटेरियल तो नहीं है जिसको वो छूना ना पसंद करें। सो थोड़ा सा कॉशन के साथ अगर हम हैंड्स ऑन एक्सपीरियंसेस की बात करेंगे तो बेटर होगा, और ये भी इनकी वन ऑफ द स्ट्रेंथ है। एक और स्ट्रेंथ है जिससे कि अगर आपके डेली रूटीन में प्रिडिक्टेबिलिटी है, एक स्ट्रक्चर है, अगर बहुत क्लियरली पता है कि पहले ये एक्टिविटी होगी, फिर ये एक्टिविटी होगी, फिर उसके बाद ये एक्टिविटी होगी, सो बच्चे बहुत जल्दी, स्वलीनता वाले बच्चे, ऑटिज्म वाले बच्चे बहुत जल्दी अपनी डेली रूटीन, क्लास रूटीन के साथ एडजस्ट हो लेते हैं क्योंकि चैलेंज जो है वो फेस करते हैं जहां पर अनप्रिडिक्टेबिलिटी है, जहां पर स्ट्रक्चर नहीं है डेली रूटीन में। इसी तरह से डेली रूटीन में प्रिडिक्टेबिलिटी, स्ट्रक्चर होगा और रूल्स बहुत क्लियरली अगर लिखे गए होंगे विद विजुअल सपोर्ट तो वो बहुत जल्दी उनको फॉलो करते हैं और फॉलो करने से पहले समझ भी जाते हैं। फिर प्लीज यूज एज, और इनका स्ट्रेंथ लाइज इन यूजिंग इलेक्ट्रॉनिक गैजेट्स और ICT बेस्ड गैजेट्स। व्हाई? Because ICT based gadgets, they provide visual support and they give predictability to the next event. Then last but not the least, children with autism many a times are found to have eye for detail. Say for example, अगर उन्हें इंटरेस्ट आया है कि पेन या पेंसिल या पेपर के ऊपर, नोटबुक के ऊपर कोई डिजाइन बना है and they are interested in that, so they'll focus on that irrespective of कि ये हमारी उस पर्टिकुलर कॉन्टेक्स्ट क्लासरूम के लिए शायद बहुत ज़्यादा सिग्निफिकेंट नहीं है, पर क्योंकि उनका फोकस्ड अटेंशन है तो दैट कुड बी इफ टेकन एज अ स्ट्रेंथ विल प्रूव बेनिफिशियल फॉर लिंकिंग एंड एंगेजिंग विद द करिकुलम एंड क्लासरूम एक्टिविटीज। नाउ क्लास कंसर्न्स के बारे में जब हमने बात की थी तो हमने बात की थी क्लासरूम रूल्स के बारे में। सो लेट्स सी हाउ टू modify, accommodate classroom rules for a child with autism who is sitting in our classrooms. Say for example, हमारी क्लास का नियम कहता है कि हम ये अपनी कक्षा को साफ रखना है और इसके लिए हम पेंसिल छील करके या पेपर का जो वेस्ट है या किसी भी तरह का वेस्ट है उसको हम डस्टबिन में डालेंगे। अब हमारे पास एक बच्चा ऐसा भी है, लेट्स से भारती ही है वो बच्ची जिसको ऑटिज्म है, स्वलीनता है और वो क्लास में है। अब इस क्लास में आपने तो ये क्लास रूल लिख करके सबको बता भी दिया कि देखो बच्चों क्लास में सबको सफाई रखनी है, जो भी गंद है वो डस्टबिन में डालना है, पर मुझे तो समझ में नहीं आ रहा। क्यों? क्योंकि मेरा चैलेंज लाइज इन अंडरस्टैंडिंग लैंग्वेज, माय चैलेंज लाइज इन सेल्फ एक्सप्रेशन। तो मैं कैसे मॉडिफाई करूं इस क्लासरूम रूल को? तो जो क्लासरूम रूल मैंने मॉडिफाई किया भारती के लिए वो शायद ये है कि मैं आई थ्रो पेंसिल shavings, paper tear in dustbin, placed near the cupboard in the class. अब मैंने सबके लिए जो लैंग्वेज लिखी थी क्लास रूल की, उसको मैंने आई की फॉर्म में लिखा कि मैं कचरा, पेंसिल के छिलके, पेपर, फटे हुए पेपर या किसी भी तरह का कचरा अलमारी के कक्षा में, अलमारी के पास जो डस्टबिन रखा है मैं उसमें डालूंगी या डालूंगा। और साथ ही डस्टबिन की हमने पिक्चर भी दिखा दी। तो इस तरह से ये बहुत माइनर सी अकोमोडेशन है। अब आपको करना क्या है, आपने क्लासरूम के रूल्स को इस तरह से परिवर्तित किया, बदलाव किया, अकोमोडेट किया। अब इस रूल को इजी एक्सेस के लिए, क्योंकि एक ये पर्टिकुलर बच्चे के लिए है, भारती के लिए है, तो इसको भारती की आप डेस्क पर टेप कर सकते हैं, पेस्ट कर सकते हैं। और कभी भी अगर फिर इस तरह का बिहेवियर जो कि रूल के विपरीत है, अगर आप करते हुए बच्चे को देखें, तो आप ये कह सकते हैं कि देखो आपकी डेस्क पर जो रूल लिखा है, आप उसकी ओर इशारा कर सकते हैं, ताकि बच्चे को प्रॉम्प्ट मिले अपना बिहेवियर सुधारने के लिए। क्योंकि स्वलीनता मतलब स्व में लीन, ये बच्चे ऐसे हैं जो अपने ही संसार में खोए रहते हैं। इनके लिए अपना संसार, अपने संसार का दायरा सीमित है। तो इसीलिए तो हम इन्हें स्वलीन कहते हैं। जो कुछ भी हो रहा है इनके अपने संसार में हो रहा है, तो शायद इसीलिए वह बाहर की दुनिया से कनेक्ट करने में थोड़ी इनको प्रॉब्लम्स आती है, थोड़ी परेशानी होती है। तो इन्हीं की दुनिया में आपको थोड़ी सी और मुझे एज ए टीचर एंट्री लेनी पड़ेगी और नियमों में और गतिविधियों में थोड़ा बदलाव करना पड़ेगा। तो ये बात तो हुई क्लासरूम रूल्स की। इसी तरह से बाकी के कुछ नियमों को भी हम बदल सकते हैं। जैसे कक्षा का अगर नियम है कि बिना परमिशन के बाहर उठ करके नहीं जाना है या बिना परमिशन के बात नहीं करनी है, तो ये तो नियम आपने लिख दिया, लेकिन अब अगर मॉडिफाई करना है तो क्या करेंगे? आई सीक परमिशन बिफोर स्पीकिंग इन द क्लासरूम, आई सीक परमिशन बिफोर मूविंग आउट ऑफ द क्लास। सो थोड़े थोड़े बदलाव के साथ हम इन बच्चों को कक्षा में बहुत सहजता से इंक्लूड कर सकते हैं। इसी के साथ ऐसी बहुत सी चीजें हैं जो बाकी बच्चे तो सरलता से, सहजता से सीख जाते हैं, क्योंकि शायद वो कुछ इस तरह के चैलेंजेस जैसे स्वलीनता वाले बच्चे करते हैं। और जिस तरह के कल्चर की बात मैरी जी कर रही थी, ऑटिस्टिक कल्चर की, तो हमें उससे भी अवेयर होना है। और उसमें अवेयर ही नहीं होना है, एक्सेप्ट भी करना है। क्योंकि एम्स से जो डॉक्टर हैं उन्होंने यही कहा कि अवेयरनेस और एक्सेप्टेंस, अवेयरनेस के बाद जो नेक्स्ट स्टेप है वो एक्सेप्टेंस है। और एक्सेप्टेंस का मतलब ये है कि हाँ, हम जानते तो हैं, जानने के बाद अब हमें उसे अपने व्यवहार में भी लाना है। तो हम जानते हैं कि स्वलीनता वाले बच्चे अलग तरह से सोचते हैं, स्वलीनता वाले बच्चे अलग तरह से व्यवहार करते हैं, लेकिन इनके ये जो अलग तरह से सोचना और व्यवहार करने का जो स्ट्रेंथ है, इसको मैं क्लासरूम्स के में कैसे इस्तेमाल करूं ताकि ये बच्चे तो लाभान्वित हो, इनको तो बेनिफिट मिले ही मिले, बाकी इनके साथ जो बाकी पीयर्स पढ़ रहे हैं, बैठे हैं, वो भी बहुत सहजता से इन्हें अपनी मित्र मंडली में शामिल कर लें। तो देखते हैं क्या हो सकती है कुछ वो सेल्फ मैनेजमेंट स्किल्स। एक टीचर, इससे पहले कि मैं सेल्फ मैनेजमेंट स्किल्स पर आऊं, एक उदाहरण देना चाहूंगी। एक स्वलीनता वाला बच्चा अपने क्लास के बच्चों के साथ खेलना चाहता था। अब क्योंकि सेल्फ एक्सप्रेशन में थोड़ा सा चैलेंज है, तो ये बच्चा जाकर के बाकी लोगों को ये नहीं कह पाया कि मुझे आपके साथ खेलना है। तो अब क्या होता था, जब भी ये बच्चे प्लेग्राउंड में खेलते थे, ये बच्चा आता, मिट्टी उठा करके उनके ऊपर फेंक करके चला जाता, या थोड़ा पास जाकर के उनका गेम डिसरप्ट करके किसी और तरीके से चला जाता। अब ये बाकी बच्चों ने जाकर के टीचर को कंप्लेंट किया। अब टीचर समझदार थी, तो उन्होंने कहा कि देखो बेटा, जब भी अगर इस तरह की बात हो रही है तो आपको ये समझना है कि वो बच्चा आपके साथ खेलना चाहता है, आपके साथ आपकी गतिविधियों में शामिल होना चाहता है, पर वो अपनी बात को व्यक्त नहीं कर पा रहा है, एक्सप्रेस नहीं कर पा रहा है जिस तरीके से आप अपनी बात को एक्सप्रेस करते हैं। तो बाकी बच्चों को पीयर सेंसिटाइजेशन भी यहाँ पर जरूरी है। तो देखते हैं कि हम पीयर्स के साथ साथ स्वलीनता वाले बच्चे को भी कैसे सेल्फ मैनेजमेंट सिखा सकते हैं। तो उसके लिए कुछ नियम हैं, छोटे छोटे से रूल्स हैं जो बहुत हेल्प करेंगे एज ए टीचर हमारी कि हम बच्चों को कैसे हम जो सोशली अप्रोप्रिएट बिहेवियर है, अप्रूव बिहेवियर जिसे हम कहते हैं, हम वहां तक लेकर के आए। जैसे हम बच्चे के डेस्क पर जो हमने रूल्स मॉडिफाई करके पेस्ट किए, उसी तरह के हम कुछ ऐसे क्यू कार्ड्स बना करके बच्चे को दे सकते हैं। जैसे आई कैन यूज आई मैसेज टू टेल पीपल हाउ आई फील। जैसे, और इसका उदाहरण भी है कि अगर बच्चा ये भी कह सकता है सामने वाले को, क्योंकि उसे सेल्फ एक्सप्रेशन नहीं आता, तो मुझे ही और आपको सिखाना है हम कि बच्चा ये कह पाए कि मुझे बुरा लगता है जब आप मुझे अपने साथ नहीं खिलाते हो, या मुझे बुरा लगता है जब आप मेरे साथ लंच नहीं शेयर करते हो, या मुझे बुरा लगता है जब आप मुझे इग्नोर करते हो, मुझे अनदेखा करते हो, मुझे अपनी गतिविधियों में शामिल नहीं करते हो। तो इस तरह का एक रूल हम बच्चे को दे सकते हैं ताकि उसे क्यों मिले कि वो किस तरह से अपनी बात सामने वाले तक पहुंचाए। इसी तरह से जैसे कि मुझे क्वेश्चन पूछना है या मुझे मदद चाहिए, तो मैं अपना हाथ उठा करके ये काम कर सकता हूँ। लेकिन अब जैसे मैरी जी ने भी कहा था कि ये चीज भी टीचर टू टीचर, क्लास टू क्लास चेंज हो जाती है, कॉन्टेक्स्ट बदलता है। मैथ्स टीचर शायद नहीं पसंद करे, या हिंदी टीचर, लैंग्वेज टीचर, ईवीएस टीचर शायद नहीं पसंद करे कि आप बीच में उन्हें इंटरवीन करें। तो इसके लिए हम टीचर्स के ग्रुप को भी एक साथ आना पड़ेगा, क्योंकि इंक्लूसिव क्लासरूम सेटिंग्स हैं, इक्विटेबल एजुकेशन की हम बात करते हैं, तो टीचर्स को भी एज ए टीम एक कोहेरेंस एटमॉस्फेयर क्रिएट करना पड़ेगा, एक लाइन ऑफ एक्शन प्रिपेयर करना पड़ेगा कि यस वी ऑल विल अलाउ चिल्ड्रन टू रेज हैंड एंड आस्क क्वेश्चन एंड विल एक्सेप्ट देयर क्वेश्चंस एंड क्वेरीज, विल गिव देम परमिशंस टू आस्क क्वेश्चंस, so that at least for a class in which we have child with autism, same structure will flow from one class to another. The almost similar rules may follow from one situation, one class to another class. So this will also give predictability and structure to our classrooms. Next rule could be, next skill could be, if I do not understand what someone is saying or doing, मैं उनसे पूछ सकता हूँ या पूछ सकती हूँ। जैसे अगर मैं देखती हूँ कि मेरे साथ में बैठा हुआ बच्चा बहुत इंटरेस्टिंग सी किसी मटेरियल्स खेल रहा है और मुझे भी खेलना है, अब मुझे अगर सेल्फ एक्सप्रेशन की ये स्किल्स सिखाई गई है, तो मैं जाकर के उनसे पूछ सकता हूँ कि आप ये क्या कर रहे हैं, क्या मैं आपके साथ खेल सकता हूँ, क्या मैं आपकी ये चीज ले सकता हूँ। और इसके साथ ही स्वलीनता वाले बच्चों को यह भी समझाया जा सकता है कि कई बार उनके वर्ड्स और एक्शंस से लोगों को वैसा महसूस नहीं होता जैसा वे खुद महसूस करते हैं। और ये रूल तो आपके और मेरे ऊपर भी लागू होता है, क्योंकि कई बार हम कहना कुछ और चाहते हैं लेकिन हमारे शब्द कन्वे कुछ और करते हैं। तो लैंग्वेज डिफिकल्टी, कम्युनिकेशन डिफिकल्टी आप और मैं भी बहुत सारी सिचुएशंस में फील करते हैं, पर वो हमारे लिए मोमेंटरी होता है। और स्वलीनता वाले बच्चों को तो ये स्किल सिखाना जरूरी है, बहुत जरूरी है। और इसके साथ ही अगर हम इन छोटी छोटी चीजों पर हम ध्यान रखेंगे तो हमारी कक्षाएं सहजता से समावेशी हो जाएंगी। और ये स्ट्रैटेजी सेल्फ मैनेजमेंट की हो चाहे क्लासरूम रूल्स की हो, बाकी बच्चों के लिए भी इक्वली बेनिफिशियल हैं। इसी के साथ स्वलीनता से जुड़ा हुआ एक और चैलेंज, एक और चुनौती भी है, जो है अपने आप हम कैसे रिलैक्स करें या काम करें। तो उसके लिए रिलैक्सेशन स्ट्रैटेजीज हैं, जैसे डीप ब्रेथ लें, 10 तक गिने और धीरे धीरे स्लोली ब्रीद आउट करें, या काउंट टू 100। और जैसे आप चेयर पे बैठे बैठे आप रॉक करते हैं, और बसंत वैली से जो टीचर हैं उन्होंने कहा भी कि बजाय हार्ड डेस्क पर बैठने के हमने अलाउ किया आप एक्सरसाइज बॉल पर बैठिए और अपना काम करिए क्लासरूम के अंदर भी। तो बाकी बच्चे, कैन यू विजुअलाइज नाउ अ क्लासरूम जहां पर बाकी बच्चे बेंच पर बैठे हैं या चेयर्स पर बैठे हैं, और यहाँ एक बच्चा है हमारा जो बॉल पर बैठा है और वो बड़े मजे से बाउंस करते हुए हिलते डुलते अपना काम कर रहा है। This gives a strategy to this child with autism to deal with the sensory overload occurring in the environment. और जो अगर उसको डील नहीं किया जाए, then it may lead to behavior which is undesired and unacceptable by teachers in the traditional settings. But in inclusive classrooms, we say बी ओपन, गो आउट ऑफ बॉक्स, तो एक्सेप्टेबल बहुत सारी चीजें हो जाती हैं जो शायद हमारी ट्रेडिशनल क्लासरूम में नहीं आती हैं। और एक और स्ट्रैटेजीज ये भी है कि अगर बच्चा सेंसरी ओवरलोड फील कर रहा है, उसे ब्रेक की जरूरत है, तो इस बच्चे के लिए कम से कम हम एक मॉडिफिकेशन अपनी क्लास पॉलिसीज में ये कर सकते हैं कि हम बच्चे को सिखाएं कि अगर आपको बाहर जाना है, ब्रेक लेना है, तो बजाय चुपचाप जाने के आप परमिशन लेकर के जा सकते हो, और उसके लिए कुछ कार्ड्स, कुछ कलर्स या कुछ सिंबल भी हम इस्तेमाल कर सकते हैं, दैट इज बिटवीन टीचर एंड द चाइल्ड। इसी तरह से बेसिकली हमें बच्चे की हेल्प करनी है कि वो प्रॉपर बिहेवियर करे क्लासरूम में, अपने आप को एक्सप्रेस कर पाए, और इसी से संबंधित हैं ये इंडिविजुअल रूल्स एंड बिहेवियर कार्ड्स। तो ये बिहेवियर कार्ड्स भी दे आर नथिंग बट सम टेक्स्ट रिटन और उसी के साथ सपोर्टिव पिक्चर्स हैं। जैसे सिट ऑन द चेयर, अगर आपको दिखता है कि बच्चा क्लास में इधर उधर घूम रहा है, तो यू कैन शो दिस कार्ड टू द चाइल्ड कि सिट ऑन द चेयर और सिट ऑन द प्लेस, सिट ऑन योर बॉल, सिट एट द प्लेस असाइन टू यू। और अगर आपको लगता है कि क्लास के बीच में आप जो पढ़ा रहे हैं बच्चा उस पर ध्यान न दे करके इधर उधर देख रहा है, तो आपको क्या करना है, आपको ये कार्ड दिखाना है विच सेज लुक एट, देखो, यहाँ देखो जो मैं कर रहा हूँ, करवा रही हूँ, या ब्लैक बोर्ड पे देखो, या टेक्स्ट बुक की पिक्चर पे देखो, या ध्यान दीजिए। हिंदी में हम ऐसे भी कर सकते हैं। और अगर आपको लगता है कि बच्चा शोर मचा करके कुछ कर रहा है या कुछ नॉइजेस आ रही हैं बच्चे के मुंह से जो शायद पीयर्स को डिस्टर्ब कर रही हैं, तो इफ पॉसिबल आप बच्चे को पॉइंट आउट कर सकते हैं ये कार्ड दिखा करके। ये प्रॉम्प्ट है, ये क्यू है बच्चे के लिए कि आपको शांति से क्वाइटली काम करना है। अब ये तो हुआ कुछ बिहेवियर्स से रिलेटेड चीजें, इसी के साथ हैं पार्टिसिपेशन स्ट्रैटेजीज। लेकिन जब भी हम कक्षा में भागीदारी की बात करते हैं और उससे संबंधित नीतियों की बात करते हैं, तो हमें क्या करना है? हमें करना ये है, सबसे पहले हमें बच्चे के इंटरेस्ट पहचानने हैं कि बच्चे की स्ट्रेंथ क्या है, बच्चा किस में रुचि रखता है, बच्चा क्या काम कर सकता है। बच्चे को की वीकनेस भी हमें पहचाननी है, बच्चे की स्ट्रेंथ भी पहचाननी है, उसके इंटरेस्ट पहचानने हैं, और हमें उन्हीं के अकॉर्डिंग करिकुलम को थोड़ा सा मॉडिफाई करना है ताकि उसकी इंटरेस्ट अकोमोडेट हो जाए। से फॉर एग्जांपल आपकी स्क्रीन पर डोरेमोन दिख रहा होगा। छोटी क्लासेस में बच्चे अक्सर कार्टून देखना पसंद करते हैं, और अगर बच्चे को डोरेमोन का कार्टून पसंद है तो हम कह सकते हैं कि चलो डोरेमोन के मुंह से कहलवाते हैं कि चलो अब हम नंबर्स पढ़ेंगे, या चलो अब हम इंग्लिश का काम करेंगे, या चलो अब हम ये पर्टिकुलर एक्टिविटी करेंगे। सो व्हेन द मैसेज कम्स फ्रॉम देयर पर्टिकुलर कैरेक्टर जो उन्हें पसंद है, तो बच्चे बहुत सहजता से उसको फॉलो भी करते हैं। और आप अगर इस तरह की एक्टिविटीज, इस तरह की स्ट्रैटेजीज अपनाते हैं क्लास में, तो ये सभी बच्चे इससे सहजता से जुड़ जाते हैं। और जैसा कहा भी मैंने पहले कि उनकी स्ट्रेंथ है, कॉन्क्रीट एक्सपीरियंसेस से वो बहुत अच्छे से सीखते हैं। लास्ट में स्ट्रैटेजी लिखी है डिफरेंट वेज टू रिस्पॉन्ड। अब ये अलग अलग तरीके क्या हैं जिनसे बच्चे रिस्पॉन्ड करते हैं। अगर बच्चा लिख करके नहीं आपको आपका अपेक्षित उत्तर दे पा रहा है, डिजायर्ड रिस्पॉन्स दे पा रहा है, तो हमें करना क्या है, अलाउ द चाइल्ड टू गिव असाइनमेंट, होमवर्क्स एंड ऑल इन मेकिंग कोलाज, using ICT, using PowerPoint, or maybe something else, wherever, whichever strategy the child is comfortable with. इसी के साथ आपकी स्क्रीन पर है अब कुछ ऐसी situations जो शायद क्लासरूम में हो और आपको लगे कि अच्छा ये क्या हो रहा है, तो उसके लिए कुछ possible strategies भी हम डिस्कस करेंगे। But let's see what are these situations in the classroom one by one. कभी कभी ऐसा होता है कि आपने पूरी क्लास को ग्रुप एक्टिविटीज दी, और भारती क्योंकि उसको स्वलीनता है तो वो बैठी तो है ग्रुप में, बट शी इज नॉट पार्टिसिपेटिंग एक्टिवली। नाउ अब ये क्यों हो रहा है? एज ए टीचर यू आर वरीड कि वो पार्टिसिपेट नहीं कर रही है ग्रुप वर्क में, तो लेट्स फाइंड आउट द रीजन कि व्हाई दिस इज हैपनिंग। the child might be sitting quietly in the group activities because a group work is usually unstructured. बहुत सारी activities simultaneously हो रही होती हैं. All the kids are excited. They wanted to share their voices, their opinion, or maybe the rules are not very explicit for group work. तो जब ऐसी situation है तो maybe बच्चे को समझ नहीं आता कि अब मुझे कब बोलना है, कब चुप रहना है, मुझे क्या करना है, because lot of stimulus is coming from the environment. तो इस situation में as a teacher मुझे क्या करना है, मुझे order establish करना है. Group activities में भी एक leader है, फिर आप numbers assign कर सकते हैं कि अच्छा पहले आप बोलेंगे, फिर आप बोलेंगे, फिर आप बोलेंगे, और एक particular role assign कर दिया जाए हर एक बच्चे को. तो maybe there are a greater chances कि बच्चे, including this child with autism, they will also participate in the group activity. फिर कभी-कभी ऐसा, अच्छा सीट छोड़ करके इधर-उधर घूमने की बात तो हमने अभी डिस्कस कर ही ली है कि ऐसा क्यों होता है. मे बी अगेन बच्चा इंटरेस्टेड नहीं है जो हो रहा है क्लास में, या उसे समझ में नहीं आ रहा है, या उसे पता ही नहीं है कि जो वो अभी कर रहा है कि अपनी ही सीट छोड़ करके क्लास में इधर-उधर घूमना वो desired behavior नहीं है. Because remember the child is in his her own world. तो उसके संसार से बाहर के संसार को कनेक्ट करने के लिए हमें क्या करना पड़ेगा, या तो बच्चे को थोड़ा सा अपने संसार को छोड़ के बाहर से कनेक्ट होना पड़ेगा, या हमें समझना पड़ेगा कि वो ऐसा क्यों कर रहा है. तो बेटर यही है एज एन एडल्ट हम कोशिश कर लें कि हम बच्चे के संसार तक पहुंचे और सिखाएं कि ये जो आप कर रहे हो, leaving your seat and wandering in the classroom is not a desired behavior. तो इसके लिए भी आपको रीजन, हर बिहेवियर के पीछे के रीजन को समझना पड़ेगा और उसी पर बेस्ड स्ट्रैटेजी अपनानी पड़ेगी.
फिर कई बार वाइंड अप.
जी मैम. हेलो.
यस, प्लीज वाइंड अप.
Oh, just a minute, ma'am. Okay, so other probable situations may also have similar reasons and we may have to devise few strategies. जैसे अच्छा इसी के साथ नेक्स्ट स्लाइड बहुत क्विकली मैं दिखाना चाहूँगी, लास्ट 2 स्लाइड्स. अब जैसे ये मॉर्निंग शेड्यूल है, बच्चे उठते हैं तो सबको पता होता है कि हमें ये काम करना है. सो इफ वी हैव मॉर्निंग शेड्यूल लिस्टेड एक्टिविटी वाइज विद सपोर्ट ऑफ विजुअल्स, that will prove equally beneficial at home also. Similarly, we can convert class timetable also into visual schedule by adding a lot of pictures that will provide visual clue and support to the child and may benefit everyone. Now, इसी तरह से हम लंच के लिए भी visual schedule बना सकते हैं जो कहता है कि आपको लंच खाना है, जो बच जाए उसे लंच बॉक्स, लंच बैग में रखना है, और इसके साथ साथ आप सपोर्टिंग पिक्चर्स भी दे दीजिए, और अगर पिक्चर्स ना हो तो आप लाइन ड्राइंग्स भी बना सकते हैं. देन लास्ट बट नॉट द लीस्ट, हम विजुअल्स के थ्रू पढ़ाएंगे तो बच्चे बहुत जल्दी कनेक्ट हो जाते हैं. से फॉर एग्जाम्पल अब यहाँ पर एक पोएम है इट्सी बिट्सी स्पाइडर. पूरी पोएम नहीं है, इसकी फर्स्ट 2 लाइन्स को पढ़ाने के लिए 6 पिक्चर कार्ड्स बने हैं. इट्सी बिट्सी स्पाइडर, पहला जो कार्ड है वो स्पाइडर को दिखाता है और उसके नीचे लिखा भी है द इट्सी बिट्सी स्पाइडर. फिर क्लाइंब, तो बच्चा सीढ़ियां चढ़ते हुए दिख रहा है. अपवर्ड एरो है. वाटर स्पाउट, तो वाटर स्पाउट का पिक्चर. देन डाउन केम द रेन एंड वॉश द स्पाइडर आउट. अगेन ईच वर्ड, ईच सेंटेंस इफ यू सपोर्ट विद द पिक्चर, द चाइल्ड, बिकॉज द चाइल्ड हैज स्ट्रेंथ इन विजुअल मेमोरी, they will be able to connect easily with the classroom activities. Thank you so much for patient listening. Thank you.
Thank you, Dr. Bharti, for this additional treat in terms of how we can teach children with autism. आज अगर हम देखें कितने लोग हमारे साथ जुड़े हुए हैं तो बहुत हार्टनिंग है कि सैटरडे होने के बावजूद about 1,000 people are connected with us already, and we are closely looking at your comments. हम उनका रिस्पॉन्स आपको आने वाले हफ्ते में देते रहेंगे, और उम्मीद करते हैं कि आप किसी न किसी तरह हमारे साथ जुड़ते ही रहें और औरों को भी आप एनकरेज करें कि हमारे साथ जुड़ें। तो अब हम नेक्स्ट सेशन की तरफ चलते हैं और जैसे मैंने शुरू में कहा था, हम पेरेंट्स का व्यू पॉइंट लेना बहुत उचित समझा हमने जब हमने ये प्लान किया था। तो दो हमारे साथ पेरेंट्स इस सेशन में जुड़ेंगे जो अपने एक्सपीरियंसेस बताएंगे ऑफ पेरेंटिंग अ चाइल्ड विद ऑटिज्म। To begin this session, I have Dr. Rashmi Das with us. She is the chairperson and managing director of Mahaguri Autism Care Private Limited, and she is currently engaged in working as a chairperson for the Higashi Autism School that is being developed in Delhi. She is a chair of an online art forum for children with autism and young adults, a founder and promoter of Live Media and Publisher Private Limited. She works as an editor for them, and she is the president's nominee for the Executive Council of GNU. In addition to this, she is a member of the Board of Governors of the Indian Institute of Management in Udaipur. She is working with us at NCERT as a member of the focus group on gender education, and Rashmi Das is also the autism student on Substack. It's a website which helps to create awareness and create informed debates. She authors this newsletter, and it's a free subscription model, and therefore she is very closely associated with the children and persons with autism, and has her insights, which I now invite her to share with us. Over to you, Rashmi Das, Dr. Rashmi Das.
प्रोफेसर अनुपम आहूजा जी, एनसीईआरटी के सभी अधिकारीगण, इस विमर्श में उपस्थित अन्य सभी सम्मानित वक्ता, अभिभावकगण और अन्य श्रोता, आप सबको मेरा बहुत नमस्कार। So I've been asked to speak in the capacity of a parent today, but I will also be wearing my professional hat because that is my parenting style. I'll begin by talking about my son, of course, my beloved son, Surit. And because of him, I stepped into this A world. My son is a nonverbal autistic teen artist. He has his own web store now. He's aged 16. And you can follow his art at surit.art. And also follow me on Twitter. He has a good following on Twitter because of his art. He has sold in exhibitions. He is a VVS alumnus, Vasant Valley School, and I'm so happy Brinder spoke earlier in this program and talked about the entire practices which is followed in Vasant Valley, and my son benefited enormously from it. I wish to record my gratitude to VVS for the role they played in my son's life. Presently, Surit is on a BFA, an abridged Bachelor's of Fine Arts program, which I have designed for him based on a review of literature, of best practices and a review of literature. He also is into sports and fitness training, and he focuses on core strengthening and stamina, and he works out with his trainer. As for SNC is non-verbal, that has always been a big challenge for me because traditional SLT methods did not work with him. So I did not stop there. I never stopped looking for a method, basically with Surit. And then I went, because I come from the telecom sector, I investigated the technology domain, that what it has to offer. And then I came across this very good app, Awaz, which is MIT awarded. And now Surit, or Chintu as he is widely known by his pet name, he is being trained by an industry specialist in navigating that app. And it's a wonderful app because it just not works on the vocabulary development, it works on the syntactic development, progression to language, and what is known as functional grammar. Because obviously you cannot teach an autistic child all the parts of speech. And given my son's learning personality is such that he's a concrete learner. He understands and absorbs situations and things which are relevant to his need, likes, and dislikes. So the grammar program also is moderated on that. basis. So it's a very good program, and I am looking forward to his journey as an artist and a well-groomed young man. So I'm really looking forward to it. Suraj was diagnosed with autism at the age of 2.5, and all his milestones were perfect. He crawled at the right time, he walked at the right time, but the major red flag for me was his delayed speech milestone. And also an alert which came from this play school, because he was not involved in social play, and there was this one favorite vantage point he had, and from where he used to keep on gazing at the sky and the leaves and the birds, because nature is his obsession. It is still continues to be that is his obsession even today. He's an avid nature lover. I think that is also because of that only he went into art. He finds he's greatly fascinated by colors. So after he had diagnosis, to be very honest, I didn't break down or anything like that. I was only desperate about one thing, and that was finding the right educational resources and the structure for him. The first school which he went to, and I've written about this in detail in my newsletter, because parents need to know what is a good experience and what is a bad experience. The first experience which Suraj had was a miserable experience. He went to step-by-step nursery school because it did woefully inefficient IEPs. And I still find that today, that very few teachers have awareness about the CARS, which is the basic point, the starting point of any autism intervention, the childhood autism rating scale. They have very little awareness about the parameters. There are 15 parameters in CARS, the CAST testing, because those parameters are just don't give you a score. They also tell you how the intervention planning has to be targeted. This is totally a deficit area among teachers, and I am hopeful that NEP 2020, which is a very fine government's document in the education sector, and the government has to be commended for it because they work closely on their NEP groups. So it looks at teacher training for in special education. They look at this dimension very critically. So all in all, step by step was a very miserable experience, both mother and son, and we were in a very, very bad spot, because every meeting, the teachers would start by asking me that how much of time I spent with my son. The presumption being that a professional mother, a mother who has a professional identity, is a negligent mother. अब इस चीज़ को हमारे समाज में समझने की बहुत आवश्यकता है, और जितनी जल्दी ये चीज़ स्पष्ट हो जाए सभी के लिए, वो हमारे सामाजिक व्यवहार के लिए अच्छा होगा। वो ये बात है कि एक माँ से ज़्यादा हितैषी और हिताकांक्षी अपने बच्चे के लिए इस धराधाम में और कोई नहीं हो सकता है। तो आपको एक माँ को ट्रस्ट करना है, उसके जजमेंट और उसके परसेप्शंस को ट्रस्ट करना है। कोई भी संस्था आप चलाते हो और या फिर कुछ भी आप करते हो इस सेक्टर में, आपको एक माँ के जजमेंट को ट्रस्ट करना है। So I was very miserable, of course, and then I looked at the other alternative which was available. There's hardly any learning center in South Delhi where Suraj did not go. Again, now in hindsight, I see it, that the SLT learning which he did at that time, and this was like 4 years from 2.5 to till the time he was 7, it had one major deficit, and I see that deficit still existing in our system, and I hope the educational setup in our country takes note of that, which is that the SLTs, they work mostly on phonations and development and working up the speech articulators. That is a traditional format, very good, but they don't progress beyond that. Very few SLTs have language competence to even start doing syntactic development or language progression. The ideal situation is the merger of the traditional format and the tech platform, but that we are not seeing in our country. That is very, very unfortunate. There's a big deficit area. I hope the education systems in our country work on that. So and then we went for a lot for OT. In OT also I saw that the objectives are not properly, again, which I see evaluated in hindsight, objectives were never properly defined. There's so much OT can do in terms of self-regulation and in terms of capacity building for academic and vocational skill development, but this is not undertaken. In the US, there is a company called Real OT Solutions, and they have a lot of merchandise and they have a lot of practice material, where OT is embedded to improve writings, even to the extent of monitoring the letter size. They run a program called Size Matters. I urge everyone to look at it. It is very good, and you can benefit from it. So these are the two things which I faced at that time. The turn around for my son came when he went to VVS, to Vasant Valley School. It's a school he loves, and it is a school which I loved. It's open spaces, and it's very progressive culture, and it is led by a very strong and enlightened educationist, Shushmita Mitra, who understands that a woman can be good mothers and be good professionals at the same time. So it was my kind of place. So I was very comfortable there. So they took that gave me a lot of mental space, and because they really worked on what should have been worked upon in the initial years, settling a very healthy rhythm of life for Surid was done in Vasant Valley, and that was a big milestone for me. And another thing which they did, and that really started his journey as an artist. Because of his fascination for colors, they harvested it for his art, and they harvested it very well. And I must recognize the effort which was put by Birinder and Deepa. I mean, if you see Surid and Birinder together, it's like a dynamite teacher-student couple. They're so fond of each other, and those human connections basically really ramped up his learning, because he loved his teachers, he loved the school, he loved his teachers. He still does. And when that happened, it freed up my mental space. So when it freed up my mental space, I put all my professional, journalistic and academic lens into this subject called autism, and then I started taking a hard look at it. Because my son also, I felt, had GI issues, the gastrointestinal issues, in terms of malabsorption of food and bloating and other things, which I could not put a finger to it, because earlier I was so at the receiving end that I could not really focus on the issues at hand. So then I got in touch with and GI brain axis is known as a second gut. So the GI brain axis is very important for cognitive functioning of an autistic child. So when that was clear to me, and I went to my very good friend Lucinda Miller, who is a radiologist and an HDoc in UK. And I was in London at that time, meeting up with experts in National Autistic Society, and in Cambridge, Simon Baron-Cohen, Autism Research Center Director, and other experts in NAS UK. So she was doing Brunel University was doing an event, and she said, because I was very skeptical about whether this is actually something which is of relevant, significant concern. But Brunel University was doing a very good program, so I went there, and they had such a fascinating whole data inventory to back up that claim. And then Lucinda did. At Brunel University, another thing which I saw, which I think the educational institutions in our country need to do, is that they had a massive, around 10-page survey form of parental stress index, and they tabulated on scientific parameters there, because that is very important, that the parent has to be stress-free in order to focus on the child, because it's the parent's skin which is in the game 24 hours, 24/7. So that's very
apologies for interrupting, Dr. Das. Can you kindly wind up?
Okay. So these were the things which happened there, and that's how. And I'll just end up by saying that. So my travels took me to many places. Finally, I went to Japan, and where I met where I met the Higashi, the founders of the Higashi Institution. And they are my collaborators, and we are doing up a school based on the daily life. The pedagogy is daily life therapy method of Dr. Kiyo Kitahara, and my team is doing an Indian curriculum, sound curriculum, I believe. And I hope we will be able to serve the autistic community very well. Thank you all for your time.
Thank you, Dr. Das, for your sharing your thoughts. I would like to tell the viewers कि हम अपनी speakers की MOE की वेबसाइट पे डालेंगे, एंड दिस वी होप विल बी अ वेरी गुड रिसोर्स, जिस पर आप बाद में जाकर उनको अपने टाइम के अनुसार देख सकते हैं, पढ़ सकते हैं और एक्नॉलेज कर यूज़ भी कर सकते हैं. सो दिस विल समटाइम नेक्स्ट वीक वी विल अपलोड देम. Now I invite another parent who is does not want me to give a very long or introduction for her. Just she said, just tell them that I hail from a small but a beautiful town in Himachal Pradesh, and I am a working mother. I have 2 children, and my son Jay has autism, and he was also diagnosed with type 1 diabetes. Miss Shweta Vaidya, I hand over to you.
Thank you, ma'am. Thanks a lot. Thank you, Department of Education and Literacy, Ministry of Education, and all esteemed members present for giving. Just a sec, ma'am, my son. Sorry, yeah. Thank you for giving me this opportunity and the platform to share thoughts of a special needs parent. तो जब पहली बार क्विकली आई थिंक टाइम का थोड़ा है तो मैं थोड़ा क्विक बात करूंगी. तो जब पहली बार पेरेंट को पता चलता है, कोई फैमिली मेंबर आके बोल देता है या फ्रेंड्स बोल देते हैं या खुद को भी लगता है कि कुछ बच्चे के साथ ठीक नहीं है, देयर माइट बी समथिंग व्हिच इज नॉट राइट विद द चाइल्ड. और जब पहला ऑफिशियल डायग्नोसिस आता है, क्लिनिकल डायग्नोसिस आता है बच्चे का, जब डॉक्टर पेपर पे लिख के देता है, अपना वर्ल्ड जो है पूरा क्रम्बल डाउन कर जाता है. इट चेंजेस इन दैट पर्टिकुलर मोमेंट. स्पेशल नीड पेरेंटिंग जो रहता है, इट चेंजेस अस एंटायरली. किस तरह हम लोग फील करते हैं, किस तरह हमारी आंखें चमकती हैं, हमारे बिलीव, हमारा रिलेशनशिप, स्पाउस के साथ रिलेशनशिप, फैमिली मेंबर्स के साथ रिलेशनशिप, हमारी होप्स, डिजायर्स, ये करेंगे, यहाँ जाएंगे, हमारे डिसीजन, छोटा डिसीजन जैसे मार्केट जाना है कुछ खरीदने या कोई घर लेना है, बड़ा डिसीजन, हमारे फाइनेंसेस, सब कुछ चेंज हो जाता है इन दैट विद दैट डायग्नोसिस. हमारे लिए बहुत मुश्किल है जब हमारा ये माइंड परसेप्शन शिफ्ट होता है, जहाँ पे हम लोग सोच रहे हैं बच्चा जब होता है हमारा, एवरीवन थिंक्स बिग थिंग्स फॉर आवर चिल्ड्रन, कि अच्छा ऐसा करेगा, खुश रहेगा, घूमेगा एंड एंजॉय करेगा. वो शिफ्ट जो है वहाँ से और यहाँ तक आ जाना कि ये भगवान एटलीस्ट बस खुश रहे, सेफ रहे, ठीक रहे, वो शिफ्ट जो है दैट्स वेरी वेरी, इट्स द मोस्ट डिफिकल्ट स्विच फॉर अ पेरेंट. Because we know that it's a lifelong, it's going to impact him or her lifelong. तो पहले कुछ जो इनिशियल साल होते हैं, मेरे साथ भी हुआ है, तो मैं अपना बता रही हूँ आपके साथ. जो कुछ जैसे 2 साल से पहले जय डायग्नोज हो गया था, 5-6 साल तक जब वो हुआ तो मेरा बहुत ज़्यादा एक रेस लगी हुई थी टाइम के साथ, एक उसके डायग्नोसिस के साथ, कि डॉक्टर ने लिख तो दिया है ऑटिज्म स्पेक्ट्रम डिसऑर्डर, पर कि मुझे इससे बाहर लेके आ जाना है. यस, आई वाज नॉट रेडी टू एक्सेप्ट कि ये डायग्नोसिस डे का हुआ है. मुझे लगता था बस मैं ठीक कर दूंगी, जितना लिखा है उसको इतना प्रेशर मैंने मारा कि 4 घंटे बैठ के करना ही है टेबल टॉप वर्क, उसका ऑक्यूपेशनल थेरेपी होगी ही होगी, उसको जो है शाम को एक्सरसाइज पे जाना ही है. वो इतना मैंने प्रेशर उसको प्रेशराइज किया ओवर अ पीरियड ऑफ टाइम दैट इवेंचुअली आई थिंक ऑटो इम्यून, उसको जैसे टाइप 1 हुआ है तो वो ट्रिगर हो गया. वन ऑफ द रीजंस इज एक्सट्रीम प्रेशर ऑन अ चाइल्ड, कि ऑटो इम्यून ऑर्डर्स जो है डिसऑर्डर्स ये ट्रिगर हो जाते हैं, बट नॉट गोइंग अवे फ्रॉम दैट थिंग. तो अपना जो हमारा जो वोकैबुलरी रहता है, इनिशियली फ्यू ईयर्स में बहुत सारी वोकैबुलरी आ जाती है, अच्छा सेंसरी ओवरलोड हो रहा है, GFCF डाइट करें या हमारा प्ले वे, एंटीसीडेंट क्या था, बिहेवियर, कॉन्सिक्वेंस, बस यही सब चीजें जो है हम लोग यूजुअली न्यूली डायग्नोज पेरेंट्स दे कीप ऑन टॉकिंग अबाउट दैट. वेरियस थेरेपीज होती है, ऑक्यूपेशनल थेरेपी, स्पीच थेरेपी हो गया, स्पेशल एजुकेशन, सोशल थेरेपी हो गया, है ना. सो उसमें ही हमारा जो है वो रह जाता है. और हम एज पेरेंट्स हम लोग अपनी बेस्ट कैपेसिटी से ट्राई करते हैं. ईच एंड एवरी वन हैज डिफरेंट कैपेसिटी. जैसे रश्मि जी ने भी बोला दैट एवरी मदर, एवरी पेरेंट, दे ट्राई देयर बेस्ट कि अपने बच्चे को उनकी कैपेसिटी के अकॉर्डिंगली बेस्ट जो है, बेस्ट सूटेड एनवायरनमेंट दे और सपोर्ट करें. तो हमारा ये जो डायग्नोसिस जब आता है, इतना हार्ड होता है पेरेंट के. रश्मि जी ने तो खैर ही इज वेरी स्ट्रॉन्ग मदर, बट ये डायग्नोसिस एक्सेप्ट करना इतना मुश्किल हो जाता है शुरू में, क्योंकि एक तो लाइफ लॉन्ग तो है ही, बट इन डेवलपिंग कंट्री लाइक आवर्स जहाँ पे बोलते हैं कि सर्वाइवल ऑफ द फिटेस्ट, जो टॉप कर रहा है वही कुछ कर पाएगा, है ना। तो सर्वाइवल ऑफ द फिटेस्ट कहाँ से लेके आए, तो वो एनर्जी कहाँ से लाए हम, और वो करेज कहाँ से लेके आए, सीख करें हम, अगर हमें एक स्पेशल नीड चाइल्ड रेज करना पड़ रहा है। वो नहीं आ पाता है इतना इजीली। हमारे बच्चे, हम बोलते हैं दे आर स्पेशल नीड किड्स, पर क्या हमारी सोसाइटी ओपन है इंक्लूजन के लिए? आई डोंट थिंक सो। हमारी गवर्नमेंट बहुत सारी चीजें बोलते हैं, रहता है, अभी तक हम सुनते भी हैं, बट डू वी हैव गवर्नमेंट ऑन द ग्राउंड रियल सपोर्ट केटरिंग टू स्पेशल नीड्स? द आंसर इज अगेन नो. Forget about our society being sensitive towards all special needs. उनको पता भी है स्पेशल नीड क्या है? आई डोंट थिंक सो. हमारे बच्चे दिखते तो सबको हैं, सब देखेंगे, कुछ आवाज निकालेगा या कुछ एक्शन करेंगे हमारे बच्चे, वो सब देखेंगे, बट वो एक तरह से इनविजिबल किड्स है, कोई उनके पास जाके बात नहीं करेगा, बिकॉज दे थिंक दैट ओके इनविजिबल है वो किड्स, सोसाइटी इन जनरल के लिए. और हम लोग पेरेंट्स, हम लोग सोचते हैं कि अपने बच्चे को बेस्ट से बेस्ट एजुकेशन दे. इवन हमारे जो घर में आप सबने देखा होगा, इवन जो हमारे हेल्पर्स रहते हैं वो भी बोलते हैं कि मैडम इस इंग्लिश मीडियम स्कूल में हमने डाल दिया है. एंड इट्स वेरी हार्टनिंग, इट्स वेरी वार्म फीलिंग ऑल्सो दैट दे आर डूइंग देयर बेस्ट फॉर देयर चिल्ड्रन. स्पेशल नीड्स पेरेंट्स, आई थिंक जितने भी पेरेंट्स होंगे मेरे साथ सहमति करेंगे, हम लोग अनइमेजिनेबल अमाउंट डालते हैं, अनइमेजिनेबल बियॉन्ड आवर मींस एनर्जी डालते हैं टू सपोर्ट आवर चिल्ड्रन. और किस लिए? शुरू में तो यही रहता है कि नॉर्मल बनाते हैं, एक नॉर्मल रेगुलर स्कूल में हमारा बच्चा जो है वो चला जाए. तो द न्यूली डायग्नोज पेरेंट्स अभी भी जब मेरे साथ भी कनेक्ट करते हैं, तो द फर्स्ट प्राइमरी क्वेश्चन इज विल माई चाइल्ड बी एबल टू अटेंड अ रेगुलर स्कूल? और कब करेगा? 3 साल का तो हो गया, बोल नहीं रहा. सो वो जो है खुद मैंने भी बहुत, आई थिंक वसंत वाली में मेरा बेटा जाता है, मैंने बहुत आई हैड फॉट टूथ एंड नेल टू सी माय चाइल्ड गो इन एन इंक्लूसिव स्कूल. और मेरा सोचना ये था कि अगर नॉर्मल बच्चों के बीच जाएगा, वहां पे उनके साथ घूमने जाएगा, उनके साथ लंच करेगा, उनके साथ किताबें खोलेगा, पढ़ेगा, लिखेगा, तो वो भी थोड़ा नॉर्मलिटी की तरफ जो है वो उस तरह जाएगा. But on this platform, I would like to take this opportunity, I would like to take this liberty to say, जो मुझे अब लगता है that school inclusion जो है, it doesn't seem right to me. I find it a myth. So the primary focus has to be around catering individualized need of the children. जैसे हमारे सब टीचर ने पहले कहा कि हर बच्चे का अलग से individualized need रहता है, तो वो cater करना बहुत जरूरी हो जाता है. बट क्या हमारा एजुकेशन सिस्टम जो है, वो हमारा स्पेशल टैलेंट जो है स्कूल का, जो हमारे बच्चे का स्पेशल टैलेंट जो है, क्या वो केटर करता है? द आंसर अगेन इज अ ब्रूटल नो. हो रहा है, काम हो रहा है, बट आई विल कम टू दैट लेटर, लाइक कहाँ पे मैं भी अटकती हूँ और क्या चल रहा है हमारी लाइफ में. हमारी सोसाइटी और गवर्नेंस इतना एम्फेसिस है ऑन स्टैंडर्डाइज्ड एजुकेशन. आपके साथ एक इंसिडेंट छोटा सा शेयर करूंगी. लास्ट ईयर हम लोग पासपोर्ट ऑफिस गए, अपने जय का पासपोर्ट रिन्यू कराना था. एंड देन दे आस्क्ड लाइक कि जय का मैट्रिकुलेशन सर्टिफिकेट कहाँ है? एंड आई टोल्ड देम दैट वो नहीं है, वो जय का मैट्रिकुलेशन सर्टिफिकेट नहीं है. सो देन दे सेड दैट सिंस ही इज नॉट मैट्रिकुलेट एज पर हिज एज, तो उसके पासपोर्ट पे एक ठप्पा लगेगा ECR का, इमिग्रेशन चेक रिक्वायर्ड, कि अगर उसको कभी भी बाहर जाना होगा तो उसको कंसर्न अथॉरिटीज के पास जाना ही पड़ेगा एवरी टाइम टू डू इमिग्रेशन चेक. तो इतना तो हमारा जो फैब्रिक है, जहाँ पे ये स्टैंडर्डाइज्ड एजुकेशन इतना ज्यादा सिप इन है एट ईच एंड एवरी स्टेप. मेरे बच्चे की, जय की, एक फोटोग्राफिक मेमोरी है, मैंने लिखा हुआ है, एंड ही इज वेरी गुड विद कंप्यूटर नंबर्स, कंप्यूटर स्किल्स, नंबर्स. इतना अच्छा सिंग करता है, कोई भी गाना सुनेगा, राग सुनेगा और वो गा देगा. बहुत अच्छा स्केटर है, स्विमर है, साइक्लिस्ट है. उसका टाइपिंग स्पीड 74 वर्ड्स पर मिनट है विद 95% एक्यूरेसी. और उसकी जो मेमोरी है, जिन चीजों में उसको इंटरेस्ट है, वो माइंड ब्लोइंग है. इट्स लाइक रियली गुड. बट ही इज 17 years old and is not a matriculate. बिकॉज हमारा एजुकेशन सिस्टम, जो मुझे लगता है, माइट बी रॉन्ग, बट हमारे एजुकेशन सिस्टम एक बहुत ही टनल्ड करिकुलम है, और हर बच्चे को फिट करना ही पड़ेगा कुछ ना कुछ करके टू पास दैट टनल. वो केटर नहीं करता है कि स्पेशल टैलेंट है, अच्छा गाना बड़ा अच्छा गा रहा है, कुछ कंप्यूटर्स में बड़ा अच्छा है, दौड़ बड़ा अच्छा रहा है. वो स्पेशल टैलेंट जो है, जो हर बच्चे का डिफरेंट है, चाहे वो रेगुलर बच्चा है, चाहे वो स्पेशल नीड बच्चा है, उसको केटर नहीं करता है। बहुत स्ट्रिक्ट और रिगरस नॉन फ्लेक्सिबल रिजीम लगता है मुझे, बच्चे को जाना ही पड़ता है। अब स्पेशल नीड नो मैटर कितना भी ब्लेस हो और उसको कितना भी टाइम मिल जाए, एक्स्ट्रा टाइम मिल जाए, जय को एक्स्ट्रा टाइम मिल जाए,
You will have to wind up, please. Please wind up.
Sure. So that is like really difficult. So I'll come to the main request. So in our education system, can we have, it's my humble request as a parent, can we have subjects like computers, block printing, carpentry, kantha work, music, singing, instrumental, athletics, and other such varied subjects for our kids to choose from, to be able to do matriculation, higher secondary and formal training courses. I humbly request support and a clear direction for our kids and for us as special needs parents. Once my child is 18 years old, which is early next year, अगले साल 18 का हो जाएगा, I don't see any ray of light and any ray of hope for him to be able to get up in the morning and go out and use his time constructively. और यही सोच के हम लोगों ने we have decided to move to Singapore. इस महीने ही हम लोग शिफ्ट कर रहे हैं, but बाकी parents and the other kids who do not get such opportunity to go and explore, तो हमारी कंट्री में ऐसी अपॉर्चुनिटीज क्यों नहीं है और हमें भी क्यों छोड़ना पड़ रहा है अपना कंट्री? दिस इज लाइक रियली हार्टनिंग। तो हम लोग छोटी छोटी चीजों के लिए तो बात करते हैं कि किस तरह सपोर्ट करेंगे इन द इनिशियल इयर्स ऑफ द चाइल्ड, बट गोइंग फॉरवर्ड लाइक आई थिंक इट्स अबाउट टाइम टू टॉक अबाउट बिगर थिंग्स फॉर आवर चिल्ड्रन नाउ। थैंक यू, थैंक्स अ लॉट।
Thank you very much for your input. It's good time that you are asking for the changes with the NEP 2020. The new curriculum is on the anvil. तो ये जो changes हम जिनकी बात कर रहे हैं, हम उम्मीद करते हैं इनको हम ज़रूर कंसिडर करेंगे और डालने की पूरी कोशिश करेंगे. So now we have another perspective that we will take up today, and that's on technology as an enabler. And for this we have Shri Manu Kohli with us. Let me tell you a little bit about him. He also has a child with autism, and he tells us that the child was diagnosed late, and that motivated him to start his doctoral work and a company to overcome the limitations of delayed diagnosis and improve access. Mr. Kohli has 16 years of global data and analytics experience. He has extensively consulted and set up the IT roadmap, integrated machine learning for clients in various sectors, and has experience across Europe, India, and the States. He is a founder of Cogniable, where they have developed and validated artificial intelligence-based diagnostic and intervention solutions for children with autism. With this short introduction, I hand over to you, Manuji, to share your thoughts. You have 20 minutes with you. Thank you.
Hello, good afternoon, everyone. Thank you so much for giving this opportunity to share my experience of the technology side, and also as a perspective of a parent on how the technology can really improve the access, affordability, and the quality of both diagnostic and prescriptive platforms. So let's start with the Cogniable. So why the need of technology? If we really look at the numbers and the guidelines of what government has to say, so Indian Academy of Pediatrics says that every child should be screened for a neurodevelopmental delay between 18 to 60 months or 30 months of age. So there are different guidelines, I'm not getting into that, but every child should be screened. 25 million children take birth in India every year. With a diagnosis rate of 2%, right, you are looking at 500,000 new cases of autism every year. 500,000, 500,000, more than the population of various countries in Europe. Where do the children will go? Are we able to first of all detect every child, measure every child on the risk of 25 million? Is it Are we doing that? Are we even doing 10% of that? The numbers are huge. Second thing is, वो 500 billion जब system में आता है हमारे, कहाँ जाता है वो? How many of those can afford early intervention services? How many of those find a place in early intervention centers that are available for families to find a free access? How many of those can go into a public healthcare facility and find an intervention solutions that the government should take care of? It's really not happening. So where do they go? They go and take the solutions, evidence-based or not evidence-based, to from various service providers. यहाँ पे GFCF, sensory needs, stem cell, everything is presented to them on a plate. They have to choose what they have to take, and the choice is very limited. It is guided by I don't know what, but the evidence behind what they should choose is not there. Right. And I think these are the only numbers of autism. If we talk about the learning disability and ADHD or hyperactivity, that numbers goes to 20% of the new births that happen every year. So, and every family, I mean, most of the parents are here, they spend almost, I think 5 to 6 lakh rupees a year, which probably may not be the salary of a lot of people to take care of children. And I think we get a lot of requests on how the affordability can come into the system. So, what the challenges we are seeking here is access. A person sitting in a remote town in Jharkhand, can he get access to early detection and intervention services? Affordability. Can it, a school teacher with a child with autism can get as good services as somebody who probably is a CEO in an organization? And the quality, is a best physician or a clinician in town sitting in Delhi, can somewhere these quality over limitations can overcome. And what it happens is, because of these three limitations, we have delayed diagnosis, we have delayed start of intervention, the neuroplasticity of the brain is highest in first 5 years, the intervention quality is very subjective, parent empowerment is a very big factor, and the acceptance is a very big factor. And I think a lot of parents in this group will agree that disability certificate निकलवाना और बनाना वो अपने आप में एक different project है, जो एक पासपोर्ट से बनाने से 10 times more difficult है, right? So passport is इस देश में बहुत easily बन जाता है. I heard ma'am saying about the immigration clearance not required, but disability certificate बनवाना, I have personally gone 10 times, visited with no success around it, with diagnosis from UCLA doctors certifying that my child had autism, and then in the end it's an acceptance. So actions क्या करने हैं हमको उसके लिए? एक तो यूनिवर्सल स्क्रीनिंग जो हमारा कंसेप्ट है उसको इम्प्लीमेंट करना है. हमारे क्लिनिशियंस की जो कैपेसिटी है वो सिग्निफिकेंटली एनहांस करनी है टेक्नोलॉजी के साथ. पर्सनलाइज्ड टेलर मेड इंटरवेंशन जो चाइल्ड स्पेसिफिक है उसको लेके आना है विद द हेल्प ऑफ टेक्नोलॉजी, और पेरेंट का एम्पावरमेंट करना है, बिकॉज पेरेंट हैज टू रन दिस लाइक अ मैराथन. Not like a 100-meter race. You will get exhausted if you try to run it like a 100-meter race. So it has to run like a marathon. You have to run slow, but आपका empowerment उस marathon के अंदर होना बहुत जरूरी है, because ultimately you have limited money, you have limited cash, and you have your spending needs on your child's treatment has to be very much focused and aware about. So this is me, this is my wife, this is my son, in the picture. So my wife was in this field before even we got married. She was studying a postgraduate diploma in early intervention from NIMH when my son was kind of diagnosed. And let's come to the solutions what we have developed. And I think the objective of our presenting solutions here is are two. One is a very critical feedback of what we have developed. Second thing is a possible collaborations with all the people here right now, including the government bodies, NGOs, and other people, for a possible collaboration on how our developed technology can find a fitment here. So the first thing what we developed was an early screening solution. Can I identify a child very early on an autism risk? And this was a very large-scale clinical trial that ran with 1,250 subjects with hospital like Maulana Azad Medical College, AIIMS Jodhpur, Nimhans, Safdarjung Hospital in Delhi. And it is one of the most advanced work that has ever happened in the area of artificial intelligence and in the world of autism. So what we do, we did 3 things. One was कि हमारे जो community based workers होते हैं, क्या उनको हम एक ऐसा टूल दे सकते हैं जो एक 10 मिनट्स के अंदर में ऑब्जर्वेशंस रिकॉर्ड करके एक ऑटिज्म रिस्क को बता सकता है. हाँ, हमने किया, एक क्वेश्चनर बेस्ड सिस्टम डेवलप किया. उस क्वेश्चनर के ऊपर क्वांटिटेटिवली आप क्वेश्चंस के रिस्पॉन्सेज करिए, और पीछे में एक एआई मॉडल है जो अनलाइक अदर क्वेश्चंस होते हैं जो एक स्कोर कंप्यूट करते हैं, वो स्कोर कंप्यूट नहीं करता है, वो रिस्पॉन्सेज के ऊपर ही लर्निंग करता है अपनी. और जिसका गोल्ड स्टैंडर्ड डेटा हमने चाइल्डहुड ऑटिज्म रेटिंग स्केल के ऊपर पे सेट किया था. 1250 सब्जेक्ट के ऊपर ये डेटा लिया गया, जो 95% एक्यूरेसी से ये बता देता है कि चाइल्ड को ऑटिज्म है या कोई अदर डेवलपमेंटल रिस्क है या वो टिपिकली डेवलपिंग है, राइट? So in less than 10 minutes you get those answers very quickly, and we have been trying to take it to the market. There are few collaborations going on with the government and with private players. Unfortunately or fortunately उसकी demand India के बाहर बहुत ज़्यादा आ रही है compared to India, and I think the introspection we have to do it with an ecosystem here is कि क्या हमारे लिए technology based solutions का ecosystem are we ready for it right now or are we too early? So वो एक इकोसिस्टम डिलीवरी मॉडल है, बट हमने बनाया, उसको वैलिडेट किया. और जो सेकंड चीज हमने डेवलप करी वाज कि जो हम बच्चे का एक बिहेवियर देखते हैं, राइट, उसकी इमिटेशन स्किल्स, उसकी मोटर स्किल्स, उसकी जॉइंट अटेंशन स्किल्स, उसके फेशियल एक्सप्रेशन, उसकी इमोशंस, वो बहुत सब्जेक्टिव अंडरस्टैंडिंग के साथ एनालाइज होती हैं जब वो एक बच्चा को हम मेजर करते हैं. somebody with 20 years of experience may be able to look at that video or that child analysis with a much detailed eye than a person who is fresh out of college. So क्या मैं एक मशीन लर्निंग और आर्टिफिशियल इंटेलिजेंस को पावर दे सकता हूँ कि क्या वो उस सेशन को, उस बच्चे की एनालिसिस को बहुत क्वांटिटेटिवली कंप्यूट करके और क्वालिटेटिवली कंप्यूट करके एक असेसमेंट रिपोर्ट बता पाए जो उस बच्चे के बिहेवियर्स, फेशियल एक्सप्रेशन, इमोशनल अंडरस्टैंडिंग, उसका एंगेजमेंट विद द थेरेपिस्ट, उसके रीइंफोर्सर्स का प्रेफरेंस, उसका पीपल प्रेफरेंस can generate a report which makes a life of a person very easy. और हमने ये किया. तो हम लोगों ने एक ये पूरा पार्ट ऑफ क्लिनिकल ट्रायल था जो मैं आपको दिखा रहा हूँ. इसके अंदर हमने कुछ वीडियो बेस्ड असेसमेंट्स के लिए आर्टिफिशियल इंटेलिजेंस मॉडल्स बिल्ड किए, और वो मॉडल्स जो हैं वो हेलो वो बच्चे की एक मोटर एंगेजमेंट बताते हैं कि बच्चा एक मोटर बिहेवियर्स को कैसे रिस्पॉन्ड कर रहा है, सेल्फ स्टिमुलेटरी बिहेवियर, हाइपर एक्टिविटी, फेशियल एक्सप्रेशन, उसका आई कांटेक्ट, उसका 3 मिनट के टाइम पे कितने टाइम पे वो सैड था, हैप्पी था, डिसगस्टेड था, सरप्राइज था, फियर पे था, न्यूट्रल उसका इमोशंस थे. वो पूरी की पूरी रिपोर्ट जनरेट करता है. उसकी एक एंगेजमेंट को एनालाइज करता है थेरेपिस्ट के साथ कि कितना टाइम बच्चा रीइंफोर्सर के साथ खेला, कितना टाइम वो भागा, कितनी देर बैठा, कितनी देर मीनिंगफुल एंगेजमेंट में रहा, कितनी देर वो एक इंस्ट्रक्शन को फॉलो किया. तो इसको एक क्वालिटेटिव रिपोर्ट में बना के एक पेरेंट के लिए और एक थेरेपिस्ट के लिए बहुत ज्यादा एम्पावरमेंट होता है कि एक पर्सनलाइज इंटरवेंशन प्लान कैसे डेवलप हुआ जा सकता है. तो ये पहला सॉल्यूशन था हमारा जो हमने जिसके बारे में बात करी. सेकेंड सॉल्यूशन जो था वो ये था कि जब हम इंटरवेंशन प्लानिंग करते हैं बच्चे की, I think there were a lot of experts who went ahead in that, and they are very much experienced at than what we have. But second clinical trial था हमारा कि क्या मैं एक cloud based platform पे automatic IEP generation trigger कर सकता हूँ जो IEP उस बच्चे के लिए specifically उस बच्चे के लिए tailor made हो. वो उस IEP के साथ उसका goals तो बन के आ ही रहे हैं, उसके goals के साथ उसकी resources कि उनको वो goals सिखाने कैसे हैं, उनके videos कि कैसे उसको डेमोन्स्ट्रेट करना है, उन आईपीस पे उसकी प्रोग्रेस कि बच्चे ने ये हर रोज कितना किया, कितना नहीं किया, और उन रिस्पॉन्सेज के बेसिस पे उस प्लान का पर्सनलाइज होना उस बच्चे के हिसाब से बेस्ड ऑन 10,000 अदर बच्चे जो हैं सिस्टम के अंदर, वो एनालिसिस करके उसको पर्सनलाइज करना. दिस इज द सेकंड थिंग दैट वी डिड. सो ये हमारा क्लाउड प्लेटफॉर्म है जो मैं आपको दिखा रहा हूँ. इस क्लाउड प्लेटफॉर्म में बहुत कुछ है. उसमें पहली चीज तो एक करिकुलम ही है कि आप उसमें डिफरेंट तरीके के करिकुलम जो हैं हम उसमें देते हैं, अप्लाइड बिहेवियर एनालिसिस, स्पेशल एजुकेशन, ऑक्यूपेशनल थेरेपी, और इसमें आप अपने भी कोई भी करिकुलम जो है आपके हिसाब से ऐड कर सकते हैं, डेनवर मॉडल और व्हाटएवर. उसके बाद आप एक बच्चे की एक असेसमेंट्स हैं जो असेसमेंट्स करते हैं, वो एविडेंस बेस्ड असेसमेंट्स होती हैं. हमारे पास हम आपको कुछ असेसमेंट्स डिजिटाइज करके देते हैं, बट आप यहाँ पे एक लॉन्ग टर्म गोल, शॉर्ट टर्म गोल और बच्चे के इंटरवेंशनल टारगेट जो होते हैं वो बनाते जाते हैं। और उसके बाद कोई भी असेसमेंट जब आप बच्चे की करते हैं, फॉर एग्जांपल सोशल रिस्पॉन्सिवनेस स्केल, वैप्स, ईसा या कुछ भी करते हैं, उसके आप स्कोर्स जाके जब रिकॉर्ड करते हैं सिस्टम के अंदर में, उन स्कोर्स के बेसिस पे मेरा मशीन लर्निंग मॉडल दूसरे पेशेंट की सिमिलैरिटी को देखता है, क्योंकि एक बच्चा जो 3 साल का है और एक मेल है और 3 साल का वर्सेस फीमेल है, उन दोनों के गोल्स बहुत डिफरेंट रहेंगे। मेल फीमेल का रेशो है, उनके असेसमेंट स्कोर्स का डिफरेंस है, सोशल एरिया में कितना स्कोर है, इमिटेशन में, मोटर स्किल में कितना उसका स्कोर्स है, एक्सेट्रा एक्सेट्रा। सो एक मल्टी स्केल मल्टी डिसिप्लिनरी असेसमेंट्स को जब आप रिकॉर्ड करते हो, उसका एक मैथमेटिकल कंप्यूटेशन करके हम लोग उनका एज जेंडर के साथ, जब 10,000 बच्चे जो और सिस्टम में हैं उनके साथ कंपेयर करके उनकी ट्रीटमेंट ट्रेजेक्टरीज को कंपेयर करके एक प्रोटोकॉल या एक इंटरवेंशनल प्रोग्राम एक थेरेपिस्ट को या एक स्कूल टीचर को प्रपोज करते हैं, तो देन इट बिकम्स वेरी स्ट्रॉन्ग एविडेंस कि द ट्रेजेक्टरी दैट हैज टू बी फॉलोड is supposed to be this, because other 10,000 people out in the system, probably the top 5 that suits most closest to our child have benefited out of this treatment. And this is a recommendation, right? You can change the recommendation and move forward and select something else. That's perfectly fine. But the system gives you a power to look at that analysis and kind of see that what you should be teaching. Another thing we did was typically, the kind of आपका एक नेटफ्लिक्स पे मूवीज देखते हो जब आप, तो नेटफ्लिक्स में आपको बताता है कि आपने आज एक्स मूवी देखी तो आपको YZ भी देखनी चाहिए, क्योंकि अदर यूजर्स एक्स मूवी देखने वाले YZ भी देखते हैं। एंड दैट्स एग्जैक्टली व्हाट वी डिड। वी सेड कि आप अगर एक इंटरवेंशन गोल, एक बच्चा एक सर्टन पेस से सीख रहा है, इस बच्चे की ट्रेजेक्टरी भी अभी तक वैसी लगती है, तो यू शुड बी टीचिंग देम सर्टन अदर गोल्स which probably may benefit to you in a very quick run because other children have been doing the same. So there are a lot of computational mathematics behind it, but the goal is, can I offer a tailor-made personalized intervention to a child which a human eye cannot detect, but a machine can look at it from different perspective and propose to a clinician to choose that target for. और हमने इसकी accuracy clinician driven model के through और हमारे पर्सनलाइज्ड मॉडल के थ्रू जब कंपेयर करी तो उसमें ऑलमोस्ट 85 to 92% की सिमिलैरिटीज निकली। And there are 8 publications that we have right now that we are putting it into a peer review journals, in a very reputed peer review journal that kind of establishes the science and the evidence of this work that should find a place in management of children with autism and other developmental disorders. So ये हमने किया। And the third thing we did was कि जब मैं बच्चे का एक प्रोग्राम बनाता हूँ, आप एक प्रिस्क्रिप्शन लिखता हूँ, एक IEP लिखता हूँ, उस IEP को अंडरस्टैंड करना बेस्ड ऑन उसमें क्या लिखा गया है और उनको डिफरेंट एरियाज के अंदर डिफाइन करना, जैसे लाइफ स्किल, रिसेप्टिव लैंग्वेज, एक्सप्रेसिव लैंग्वेज, क्लासरूम बिहेवियर, इंडिपेंडेंट, एकेडमिक लैंग्वेज, उस पर क्वांटिफाई करना और उसके बाद ये देखना कि मैं उसको ऐसी चीज क्या सिखाऊं आज की डेट में जो 4 अलग चीजों को स्किल एक्विजिशन में फास्टेस्ट रेट कर सकती है फ्रॉम अ मैथमेटिकल पॉइंट ऑफ व्यू, which actually is not replacing a clinician but empowering a clinician to take the role of a more evidence-based stuff and more informed clinician decision support system. कि मैं आज की डेट में अगर एक्सप्रेसिव लैंग्वेज सिखाता हूँ तो मेरा मैंडिंग, एकेडमिक लैंग्वेज और रिसेप्टिव लैंग्वेज के चांसेस फास्टेस्ट होने के सबसे ज्यादा हैं। दिस इज समथिंग वी एल्स हम अलग से हम लोगों ने डेवलप किया। तो what is this cloud-based platform is, it has lot of tutorials, it has 17 reports जो आपको बताते हैं कि बच्चे ने प्रोग्रेस कैसे करी। अगर आप देखना चाहते हैं कि लास्ट 1 साल के अंदर या इस ईयर के अंदर बच्चे ने कितने इंटरवेंशन में सिस्टम चल रहे हैं, कितने प्रोग्रामिंग में कर रहे हैं, कितने मास्टर हो गए, तो इट जनरेट 17-20 रिपोर्ट दैट टेल्स यू एंड देन बेस्ड ऑन द डेटा इट विल टेल यू कि बॉस हाउ द चाइल्ड इज प्रोग्रेसिंग इमीडिएटली। अगर आप बच्चे के रोज सेशंस ऑर्गेनाइज करते हैं, इट विल टेल यू कि आज सेशंस के अंदर क्या रहा, सेशंस की डेली प्रोग्रेस कैसी हुई, इंटरवेंशन की कैसी प्रोग्रेस हुई, एंड देन यू कैन इमीडिएटली स्टार्ट ऑन द इंटरवेंशन टारगेट्स। सारे के सारे इंटरवेंशन टारगेट्स के अंदर रिसोर्सेज रहते हैं, इमेजेस रहती हैं, प्रोटोकॉल्स रहते हैं। फॉर एग्जांपल अगर मैं यहाँ पर एक बच्चे को कम्युनिकेट इन वर्ड और साइन सिखा रहा हूँ तो वर्ड और साइन के लिए इंस्ट्रक्शंस लिखी हुई हैं कि उसको मेरे को कैसे सिखाना है, एक वीडियो लिखा हुआ है कि उसको मेरे को कैसे सिखाना है। तो देयर इज अ कंप्लीट रिपोजिटरी ऑफ डेटा, रिसोर्सेज, कंटेंट, IEP report generation, IEP generation into a Word document, everything is digitized in nature and everything data is residing in the system so that आप एक बच्चे के साथ जो मेहनत करते हो वो 10,000 बच्चों के साथ यूज हो पाए. दैट्स द अल्टीमेट गोल. अगर आप एक बच्चे का लॉन्ग टर्म शॉर्ट टर्म गोल बना रहे हो और मैं इस लॉन्ग टर्म शॉर्ट टर्म गोल में 2 बच्चों के साथ और एक क्लिक के अंदर कॉपी करना चाहता हूं क्योंकि दे आर समवट सिमिलर, यू कैन डू इट इन अ सिंगल क्लिक. सो दैट्स समथिंग दैट वी हैव डेवलप्ड, एंड दिस इज नॉट समथिंग दैट वी डेवलप्ड एंड हम बोल रहे हैं कि हमें लगता है ऐसा है. दिस हैज बीन क्लिनिकली वैलिडेटेड. देयर इज अ peer review work around that, and there are quite a few users around that who are using it. Unfortunately, again, outside India mein we are trying our best, but we have to see ki how do we collaborate. Unfortunately, discussions goes on for months. Itne mein 5 clinics outside India start using it. India ke andar still discussion stage pe bahut zyada time hamara jata hai. So that are two things. थर्ड थिंग वॉज कि जब हम डिटेक्शन करते हैं, डायग्नोसिस करते हैं, आई थिंक एवरीवन नोज वी आर इन अ डिनाइल फेज फॉर नेक्स्ट 6 मंथ कि मेरे साथ, मेरे बच्चे के साथ नहीं हो सकता. फिर आता है फेज मेरे साथ ही क्यों हुआ. फिर 6 महीने निकल जाते हैं, फिर हम काम करना शुरू करते हैं बच्चे के साथ. यस, अभी काम करने का टाइम आ गया, एंड देन वी स्टार्ट लुकिंग फॉर रिसोर्सेज. तो वो 6 महीने का डिनाइल पीरियड और वेटिंग पीरियड और एक्सेप्टेंस पीरियड को जो छोटा करना है, वो एक बहुत क्रिटिकल टास्क है, राइट? So we developed a program called Acceptance and Commitment, which gives you a certain understanding of how you should accept this condition, how to be mindful, how to bring in the values.
Request you to kindly wind up.
Yes, ma'am. So how to bring in, accept it, being mindful with your child and mindful with your family. If you have other kids and other siblings the child has, how to be around it. So that something we did. So quickly, हमारे जो clinical trials के questionnaire based model था, takes 8 minutes to administer. हमारे video analytics 87 to 92% चलते हैं. Personalization models 87% to 92% accuracy में काम करते हैं. Autism severity हमारी app के through has shown a reduction of 11 points on social responsiveness scale for a 6 months period. We are currently in 15 cities. We are trying to work with doctors, psychologists, therapists, not-for-profits, board-certified behavior analysts, and schools to take this solution in multiple cities. There are some of the feedbacks from our clients, जो doctors भी हैं, pediatric neurologists हैं, pediatricians हैं, and next step, this is the last slide. Schools should adopt universal screening. I think the first point of contact of a child is in school. The government hospital EIC centers, the capacity enhancement में the software can play a very important part. Third thing is a public-private partnership. It's a very new concept in India, and I think there are few people in the Ministry of Education really trying for that, and hats off to them to take this initiative that forward. But I think that's going to be a significant game changer. It is evident in multiple countries, in our country as well, how that is there. Awareness पे काम करना बहुत जरूरी है, but policy-based decision making, जहाँ पे technology एक integral part हो, is going to be a game changer for this industry. So that's how I wanted to conclude. These are some of our screenshots of our app, but thank you so much for giving us time around that.
Thank you very much for sharing this game changer and a step in the right direction for the future. As we said, this awareness day is going to carry on. It's not just aaj ka event and that we end here, or we are creating a stir. We want this to stay with the viewers. And I again thank कि 1000 से ऊपर व्यूअर्स हमारे साथ पैन इंडिया से जुड़े हैं. ये बहुत क्रेडिटेबल है इस वक्त जो कि आज कहा जाता है छुट्टी का दिन है. सो वी आर रियली कीन टू वर्क ऑन to be able to organize this. With this Manuji's presentation, we conclude the day and come to the closing session. And I'm very, very happy to say that for the concluding session, we have none other than our director NCERT with us and the joint director of CIT. I now will ask Aloka ji to share the way forward. And let me just give a short introduction about her. And you all know that we have with us, we have had medical professionals, we have had teachers, we have had teacher educators, and we have parents' perspective. Dr. Aloka, she is a former chairperson of the National Trust for Persons with Autism, Cerebral Palsy, Intellectual Disability, and Multiple Disability. As a founder chairperson, she has over 40 years it's almost a lifetime, 40 years of experience. तो बहुत दिनों का, बहुत सालों का तजुर्बा है इनके पास. She has led various roles as a controller of exams, RCI के साथ जुड़ी रही हैं, MSJE के साथ जुड़ी रही हैं और mental health and substance abuse unit के साथ बहुत काम किया है. We are also happy that she has represented Government of India in elaborating the UN conventions on disabilities. So over to you, Aloka ji, for summing up the day in a way and giving us the way forward. How do we take this awareness program forward and keep at our efforts? हमको अब कभी भी ढील नहीं देनी है. इस एरिया में बहुत काम करने की ज़रूरत है और उसके लिए वे फॉरवर्ड क्या है? Over to you.
Thank you so much, Dr. Ahuja. I hope you can see my screen and hear me clearly.
Yes, we can.
Okay, thank you. So I want to be able to say that the way forward, where I'm sharing 7 steps, is actually already been said by every speaker so far, and each speaker has been brilliant. I'm showing the neurodiversity symbol, the infinity symbol, which is in addition to the puzzle symbol that signifies autism. My first slide is to say that we started a long time back in 2012 with autism as part of the policy and the law in India. So itne saal mein humne kya kaam kiya hai, iske bare mein to aaj I'm not doing a list, but as previous speakers have said, a lot more needs to be done. So when the RT was amended in 2012 and included all the disabilities under the then Persons with Disabilities Act and the National Trust Act, which started with autism, not only were they included in mainstream schools under Section 2D, but there's something that has been bothering us a lot, is that they have a right to opt for home-based education. And that option is not with the teacher. It's with the family to decide whether they want to be in the school or in a resource center or in home-based education. Some data, I want to be able to say that the retention rates for CWSNs in SSA has not been very supportive. It starts with about 89% and comes down to 2.3% by the time we reach grade 11 and 12. So why is that? So all of the reasons that were said earlier, lack of access to the curriculum, not just the physical space. That is probably the most important one. I also want to be able to bring to the notice of everyone again that the Supreme Court interim order of 2021 October talks about the situation of education of children with special needs in school. And they point out that there is a need for making corresponding changes in Schedule 1 when the RT Act was amended. So in para 54, this has not happened, and that's, I think, where we should begin. So that's step 1. Step 2, I find that in accessing mainstream education, there is a lot of intra-disability differentials, as you can see from this data, which is actually from the census, but taken on by the UNESCO book, that a large number of children with multiple disability and mental retardation, as you know, intellectual disability now includes autism spectrum disorders. They have never been to school, and if they have, then they've dropped out in large numbers. And that's largely because of lack of access to the curriculum. And the third step I want to talk about is what my previous speakers have said also, that there should be a very real rights-based approach to education. We have to remind ourselves and our viewers that persons with disabilities, including autism, are rights holders, and governments are duty bearers. And there's a whole framework which we need to adopt in order to move ahead. And step 4 is designing and implementing a very calibrated, structured, and a national level cascade model of training of general teachers and the strengthening of resource centers. Now, NEP talks about guidelines for many other things. They don't mention guidelines for resource centers. And I think all our acts whether it's RPWD Act or the RTE Act, specific, and certainly the NEP recently, and I've quoted the places where capacity building of teachers is mentioned everywhere. And that will form the bedrock of the way forward. And NCERT has already taken steps forward. This is another step forward. We need to make it national level, and we need to find at least 1 or 2 or 3 or 4 master trainers in every state and union territory who can then go down to the districts and make it a bigger program. So Anupamji mentioned GRI, and I want to express this a little more in detail. Why is it step 5 in my 7 steps? Because opportunities for sports facilities from a very young age and dance movement therapies